Excellencies, distinguished delegates, the next agenda item of the 7th session of the Committee on Social Development will commence shortly. On behalf of the Secretariat, I would like to provide a housekeeping announcement first. As a precautionary measure during the COVID-19 pandemic, we kindly request all present in the room to keep their masks on, except when taking the floor. Thank you.
Welcome back, everyone. Excellency, distinguished delegate, welcome back. I hope you have a pleasant evening yesterday. We will begin this morning with our consideration of Agenda Item 4, follow up to the outcome of Asia-Pacific Intergovernmental Meeting on the 4th review and appraisal of the Madrid International Plan of Action on Aging. The background document of this agenda item are review of progress in implementing the Madrid International Plan of Action on Aging 2002 in Asia Pacific. As contained in the background document, Escap/CSD/2022/3, and the outcome document of the recently held intergovernmental meeting on the 4th review and appraisal of the Madrid Plan of Action, contained in Escap/MIPAA/IGM3/2022/3/ADD1. First, I would like to invite the Secretary to deliver its presentation on this agenda item. Ms. Sabine Henning.
Thank you very much, Chair, Excellencies, ladies and gentlemen. The following presentation will provide an overview of levels and trends in population aging and the situation of older persons in Asia and the Pacific, and it will relate this to the outcomes of the recently held intergovernmental meeting on the 4th review and appraisal of the Madrid International Plan of Action on Aging in Asia and the Pacific. Due to rapid declines in fertility and mortality coupled with increased longevity, the number and share of the older population in Asia and the Pacific increased sixfold from 1950 to 2022. By 2050, that number is projected to double and reach 1.3 billion. Thus, 1 in 4 people in the region will be 60 years or older, or 1 in 7 people in the world will be an older person from Asia and the Pacific. The population in the region is aging faster than in any other world region. Due to the drastic decline in fertility and mortality, it is taking countries in the region 30 years or less to increase the share of their older population from 7 to 14%, or to transition from an aging to an aged society. As stated in the Madrid International Plan of Action on Aging, the global guiding framework on this topic adopted by United Nations member states in 2002 Population aging used to be a phenomenon of developed countries. Given its speed and the sheer number of older persons in the region, it has become a particularly relevant topic in Asia and the Pacific, with significant economic, social, and political implications for the region and beyond. Earlier this year, Escap member states and stakeholders reviewed the implementation of the Madrid Plan of Action. In preparation for the intergovernmental meeting, 22 member states submitted detailed reports on the situation of their older persons and the related policies, and stakeholders met 4 times to discuss challenges and opportunities of population aging. Member states also adopted a report of the meeting and an outcome document. When discussing population aging in Asia and the Pacific, it is important to recognize that as the number and share of the older population is increasing, the number and share of the younger population and the people in the workforce will eventually decline. By 2030, it is projected that the number of youths in Asia and the Pacific will be smaller in size than the number of older persons. This will have significant implications for the economy, but also intergenerational relations. As indicated in the outcome document, with an excerpt from the document shown on this slide, member states recognized this and called for policies and national action plans to strengthen intergenerational solidarity and discuss population aging over the life course. Given women's longer life expectancy, the share of women compared to men increases with age across the region, as you can see in the dark red patterns. Women, especially those in developing countries, enter old age with the accumulation of a lifetime of gender-based disadvantages due to fewer opportunities for education, lower likelihood of being covered by social protection, and limited access to healthcare services, land ownership, and income. In old age, they frequently continue to perform unpaid care work in the home and must often work to maintain their own livelihoods. Although women are living longer compared to men, many of the additional years are spent in less than full health, indicated by the dark red pattern in this graph referring to life expectancy at age 60, and the lighter red pattern referring to healthy life expectancy, again at age 60. Across the region, women at age 60 will spend about 5 years of their remaining life expectancy in less than full health due to disease or injury. Thus, as member states emphasized in the outcome document, gender considerations and issues related to persons with disabilities must be mainstreamed into any national response on population aging. Many older persons must continue to work in order to maintain their livelihoods. In many countries of the region, they only find work in the informal sector and are even more likely to work without social protection and under hazardous working conditions. Member states and stakeholders therefore called for promoting the right to work and for providing access to full and productive employment in decent, healthy, flexible, and age-friendly working conditions. Closely related, the coverage of contributory pensions in many countries is very low. This is connected to the high incidence of informal employment, which has left workers vulnerable to income insecurity and old age poverty. In the surveys and stakeholder consultations convened for the intergovernmental meeting, participants noted that many countries had implemented social pensions. Although these pensions are very helpful, their levels are often insufficient to cover daily and monthly expenses. At the intergovernmental meeting, member states therefore called to strengthen adequate and inclusive national social protection systems that provide universal old age income security. Although there have been significant improvements in universal access to health care, disparities between countries remain. As one can see in this slide, the level of universal health care coverage across countries in the region is often below 50%. Importantly, when assessing the availability and access of these services, financing has to be considered. In many countries in the region, public health care expenditures shown along the horizontal axis are low, leading to high out-of-pocket expenditures shown on the vertical axis. As healthcare expenditures in general increase with age, countries where out-of-pocket expenditures are high are particularly challenged. In summary, Member States called for strengthening active and healthy aging strategies over the life course. Given the particular challenges of older persons, they called for high-quality and integrated long-term care systems. They also highlighted the challenges of mental and neurological health issues and the need for support for informal and formal caregivers. Although older persons in the region in general live with their families, older women are more likely than older men to live alone. The Madrid Plan of Action encourages governments to promote aging in place. This stresses the need for independence and self-sufficiency of older persons. Furthermore, the aging in place concept requires age and disability-friendly housing designs and public infrastructure, as well as affordable accommodation and transport. Moreover, access to technology has become a lifesaver for some older persons. This has been especially the case during COVID-19. However, the great digital divide is real, as shown in this slide, with the dark bars showing the access to the internet among persons 75 years or older. With a focus on technology, Member States therefore agreed that it is not only important to provide access to technology, but also have age-friendly devices, improve digital literacy, and protect older persons' privacy. The COVID-19 pandemic has had a devastating impact on health and social economic situations of older persons. Based on the latest data, between 2019 and 2021, older persons at age 60 in the region lost about 1.5 years in life expectancy, due mostly to COVID-19. In addition, movement restrictions, lockdowns, and delaying regular health checkups have had significant physical, social, and mental health impacts on older persons. At the meeting, Member States called for a regional response mechanism to provide equitable access to safe diagnostics, medicines, and vaccines. Climate change disproportionately affects older persons due to medical preconditions, challenges related to healthcare, mobility limitations, and lack of access to essential services. People in the region are highly vulnerable to climate change and natural disasters, which are on the rise and becoming more intense and unpredictable. At the same time, older persons contribute to climate activism. At the intergovernmental meeting, Member States and stakeholders called to protect older persons from climate change and other natural disasters and ensure that they can meaningfully participate in climate mitigation and adaptation. At the meeting, Escap was requested to raise awareness on population aging and facilitate the sharing of experiences and good practices. Escap was also requested to support Member States with capacity building on developing and strengthening policies and action plans. For your information, Escap is already compiling publicly available data on the situation of older persons, which are available through our Escap website. Soon, we will release a dashboard on policies on aging, action plans, and good practices from countries in the region. Escap also continues to provide support to Member States through capacity building, e-learning, and videos. In follow-up to the recently held intergovernmental meeting, the committee is invited to support Member States and stakeholders in coming together to support each other to accelerate the implementation of the Madrid Plan of Action in the region. And Member States are invited to strengthen the networks of focal points on aging and provide updated information on their policies, action plans, and good practices to Escap on a regular basis, so we can feature these in the different dashboards to facilitate information sharing. Thank you very much.
Thank you, Ms. Hanning, for your introductory presentation. You provided an overview of levels and trends in population aging in Asia Pacific and highlighted good practice and lessons learned by member state and stakeholders in accelerating the implementation of the Madrid Plan of Action. You also introduced the dashboard of policies and good practice on population aging available on Escap website. So now I have the pleasure to invite Mr. Srinivas Tata, Director of the Social Development Division, Escap, to moderate the panel discussion on accelerating the implementation of Madrid International Plan of Action on Aging in Asia Pacific.
Thank you, Mr. Chair. It is my honor again to facilitate the panel discussion among three very senior panel members on strategies and initiatives to promote the implementation of the Madrid International Plan of Action on Aging in our region, and particularly with reference to the recently concluded intergovernmental meeting, the 4th Regional Review of the Madrid International Plan of Action of Aging, which concluded on the 1st of July. So we have three panelists, all of them online. The three panelists are Her Excellency Ms. Aishat Mohammed Didi, the Minister of Gender, Family and Social Services of Maldives, who was also the chair of our intergovernmental meeting and who so ably steered the meeting to a really fruitful conclusion. We also have Dr. Marianne Sao, who represents civil society, who's the chairperson and founding director of the Sao Foundation in Singapore. With years, she's a medical doctor, but with years of service dedicated to older persons, not only in Singapore, but in sharing the knowledge of Singapore with other countries in the region. And the third panelist is Ms. Alana Officer, who is the unit head of Demographic Change and Healthy Aging Department of Healthier Population in the World Health Organization in Geneva. And her intervention is also critical in view of the recently adopted UN Decade on Healthy Aging. And so I think we have three panelists who will really provide some very beautifully complementary perspectives on the implementation of MIPA in our region. So without much ado, it's my honor, therefore, to direct my first question in this round to Her Excellency, the Minister, Ms. Aishat Mohammed Didi from Maldives. Madam, under your population aging is very rapid in our region, in Asia Pacific. In the Maldives, the share of the population 60 years or over is projected to quadruple from 7.8% in 2022 to 34.1% in 2050. So how is the country, what is the country doing to address its challenges and opportunity, and how does the country intend to face up to these challenges? Over to you, Madam.
Much Chair of this session, the moderator, Dr. Srinivas Tata, Dr. Mary Ann Zhao, Ms. Elena, and esteemed guests. It's my pleasure to sit on this panel and discuss the situation in the Maldives with regard to the question that was directed at me. What is this country doing to address the challenges and opportunities because of the estimated quadrupling from 7.8% today to 34.1% by 2050 of our aged population over 60 years. Let me begin by explaining the situation today. In 2011, the longevity or the age was 76.4 in Maldives. Today, after 11 years, it is 79.61. And there are reasons why the age of longevity is, the average is coming up so rapidly. From 76.42 in 2011, today it's 79.61. If we look at the population growth rate, in 2011 it was 0.53, and today it stands at 0.36%. So definitely, at policy level, we have to do a lot of projections, a lot of work for now and for the future. Let me begin by talking about what's happening today in the Maldives. What are the things in place that ensures even today, it's for us, this 7% is a large percent of our population. And with the pension, with the age of retirement becoming 65, especially for those in civil service and other services, the number of retired pensioners became quite large suddenly in the last 10 years. We have in place um, two programs that ensure that people who are retired, people who are above 65 in the Maldives live a life of dignity. And one is our basic pension scheme. So if we look at our social protection system, the flow where the taxpayers pay this basic pension system, any Maldivian above 65, reaching 65 can apply for and get this basic pension whether the person has contributed or not contributed towards pension as a working or non-working person. So this is a basic, this program assures or ensures that poverty for the elderly is reduced and they have a life of dignity wherever they are. And it does not matter where in the country, it does not matter which sex you are. We get this basic 5,000 Maldivian rupiah from the age of 65 till a person passes away. For those who work, they have the option of mandatory contribution. So a person's salary, a certain percent is mandated to be placed in the pension fund, and the place where you work, and if it is the civil service, equal contribution has to be provided. Pension schemes, the government pension schemes invest, hence what we contribute can increase over time with profits that come into the investments of the pension office. So I would say as far as pensions are concerned, we seem to be in a good place, and the pension office works hard to improve on what they are doing, and the use of the pension program is also utilized. Especially they do what we call the preparation for the future program, and we start with age 55. Hence, people from the age 55 pension office and this ministry, we work very closely together to start preparing people for the retirement, for living an active life after retirement, for continuing their good contributions to society even after retirement. For this, the services are very minimal, and that's something I would go back in a minute. The second program that's in place and which contributes again towards minimizing poverty and also minimizing, placing the elderly person in a dignified status is universal access to healthcare. We have full universal access to healthcare for all Maldivians. And as such, it's mostly the elderly who would be needing this universal access often. And hence, wherever they are, people are provided when it comes to emergency evacuations, when it comes to hospitalizations, all of this is covered, and we do this. So there is a priority is given to the elderly. Very quickly, let me also say the biggest challenge we have, as I said before, is the services across the country. We are now starting a community for the first time in the country. We would have by the end of this year a community center, and I look forward to working very closely with our Singapore friends, this our foundation, as we make this community service center into a place where especially the large population in Mali can enjoy. We are also revising the National Social Protection System and looking into what more programs can be put in place as this population increases. This will be based on the revision of the National Social Protection Framework. A Social Protection Act will be revised, and also our Elderly Act is now in Parliament, and the discussions will begin this month in Parliament for the Elderly Act. So very briefly, this is something. In today's introduction, one of the issues that was discussed was the digital divide. This is definitely something I would really like to talk about, but I think my 4 minutes are almost up. Let me just say a few words on this. When we talk about determining health and well-being of the elderly, a lot of the services related to the health and well-being are usually these days through apps. Very often we find our elderly are not able to use these apps. So this divide, for example, my daughter might not find it very difficult to use a remote for all the things that happens inside the house, but my mom might not find that easy. So how do we bridge this gap? The digital migrants like my mom and the digital natives like my daughter, although all have access, there is a need for the elderly to be supported, to be guided, to be helped. And this is one area we would be working. It's actually the most challenging for the government to transform. As we transform into a digital society, the need to address the needs of the elderly is quite prominent. So let me conclude by saying that, again, without trying to reinvent the wheel, let's learn. Let's learn from what other countries have done to bridge this digital gap. And I really look forward to working closely with the groups that we met in Bangkok last July. And thank you very much for this opportunity.
Thank you very much, Your Excellency, for your really inspiring response, where you not only highlighted the steps being taken by the government, the steps being planned for the future, but your suggestions how countries can help each other. Really, and sets it up really well for me coming back to you in the second round for more suggestions from you. This really allows me now to move on to our second panelist, Dr. Marianne Sao. Dr. Marianne, Singapore's population of 60 years or over already exceeds 20% of the total population. So in common parlance, the country is considered super-aged. So what can other countries learn from your experience in addressing the challenges and opportunities of population aging, given that the process has been quite rapid and very little time remains to develop forward-looking policies? Over to you, Marianne.
Thank you, Mr. Srinivas. Thank you for the opportunity to share a bit of what Singapore has been doing. Indeed, Singapore has aged very rapidly, and we have very short runway. I started working in Singapore in aged care in 1992. It's about 30 years. And that's achieved a lot to the past 20 plus years, but still a lot to do across 4 key major areas. One is the health system, long-term care. 2 is productive longevity and work and retirement, volunteering, lifelong learning, and all that. The social infrastructure was issues of ageism, social inclusion, digital literacy, some as well referred to, and of course, housing and the physical infrastructure. Singapore have had multiple interministerial committees to develop a whole of society approach. And I think that's quite important because everything's interrelated, and as much as possible, everything kind of have to move at the same time. Currently, the government is organized in such a way that the Ministry of Health provides health and social care in an integrated manner, but also provides coordination across all the different ministries' efforts across aging through the Aging Planning Office. It also established about 10 years ago the Agency of Integrated Care, which addresses long-term care needs. It fits between the government and the providers can continue to identify needs as well as develop long-term care system. In 2015, there was a new policy direction I think was very important because up to that point it was more sort of Band-Aid solution. But in 2015, there was a new policy direction looks at longevity as opportunity rather than aging as all the burden comes with. And I start to invest. And that was very much based on evidence that the future can be changed by investments today. And that was very much confirmed by a recent National Cabinet Medicine report on the global roadmap on healthy longevity, that with investment, the future is positive and as good, but without the proper investments in the future could be the silver tsunami that we fear. So as a result of the 2015 policy direction, a comprehensive action plan on aging was launched with more than 70 wide range initiatives that invest in longevity, including the establishment of a national silver academy to provide some funding for older people just to learn. Our current cohorts of older people don't have high educational attainment, but for them to be able to learn is very useful. We all know that learning of any kind is a positive correlation with good health and healthy behavior. There's a lot to share, but I think I just touched on two areas, which are on health and long-term care and work and economic opportunities. On health and long-term care, I think we quickly figured out that long-term care cannot rely solely on family care or hospital institutional care. So since 1999, aging in place became a core principle of long-term care. And emphasis is very much on community long-term care, providing home and center-based care, which Minister referred to, and that could be a whole wide range, such as home help, Meals on Wheels, transportation to hospitals, home nursing, medical care coordination and management, and so on and so forth, as well as health social care integration at community level. So community nonprofit social agencies like this Health Foundation are the primary providers of the bulk of long-term care services, but is very much supported with government providing service models, essentially often piloted by community organizations. Government provides a big part of the funding, but together, very interesting with philanthropy, where donation dollars are matched dollar for dollar under the government community silver trust scheme is fundamental only for long-term care financing. And government also encourages innovation of new models as new needs arise. Many community mobilizing organizations also launch to mobilize volunteers from resident community to visit, to engage, to identify risks, and get older people involved, get them to care as quickly as possible. So many of these multi-pronged organizations working together as a system which we're trying to develop that improves care. Currently, the movement is to take up population health and preventive care, which recognize that unless we get future generation older people healthy, strong, and so on, we won't be able to stem the future tide of increasing need of long-term care use. So the goal is actually to outreach, early risk detection and intervention, engage with people socially to prevent social isolation, and enable older people themselves to come together, associations for self-care, for communication, for participation, to address a whole range of issues sort of by seniors, for seniors, and for the community. Currently, just recently, Health Minister also launched a big initiative called Health ESG, which is a shift focus from healthcare to really delivering good health through the life course, so that we can actually ensure healthier older age. And about working older people, this is much more challenging for us. As I mentioned, the current situation that because of low educational attainment of current cohorts of older people, many of them still need to work for income. Hopefully the future cohort will be different. However, even the current cohort of older professionals at PMET still face difficulties with employment. Singapore has worked very hard on this as a tripartite work group involving government, the work unions, as well as employers, and special work with older people that make a policy and practice recommendations. And the goal obviously is to enable older people to work longer, and employers to recruit and retain older peoples. So the retirement age has been going up steadily for 20 plus years I've been here, and the retirement age will steadily go up to 67. There's also retirement reemployment legislation that requires employers offer reemployment in retirement age. So when they retire, now is 63, they need to offer another opportunity of reemployment in the same organization up to 5 years. So by 2030, retirement age in Singapore becomes 65, the reemployment will up to the age of 70. There are many government schemes to enable these. The Ministry of Skills Futures of a whole range of support to enable policy goals for workers and employers. Schemes to subsidize training and retraining of mature workers, job matching, grants and programs for mid-career switches, job design, and so on and so forth. Nevertheless, currently older workers are still facing difficulty finding employment, I guess including PMETs, and that may very well be factors more social, such as ageism.
Yeah.
So I just also like to, in closing, mention the importance of digitalization, especially after COVID became so obvious that the divide is there. There's now a concerted effort to get older people better equipped digitally. And finally, as I mentioned, I think the one thing that we haven't tackled front on is actually ageism. We all know that's an elephant in the room that gets in the way of of opportunity for older people to thrive. And I think particularly perhaps in the sphere of work. So I think the ageless mindset is something that we all have to work on. So in summary, Singapore is now aiming to invest now in order to have an optimistic future. Investing in preventive care instead of additional healthcare and long-term care. Invest in workers in training and retraining so that they have better work opportunities, economic opportunities. And beyond that, right now, the current future trend is to look at maybe other ways to look at economic opportunities beyond employment. So at this, I thank you for the opportunity. Thank you.
Thank you very much, Dr. Sao. I think with your comprehensive response, which covered many dimensions, you highlighted the importance of community-based care, you highlighted the importance of aging in place, and apart from, of course, the need to address ageism in society. Your focus, therefore, on healthy longevity allows us to nicely segue to our next panelist, who is Ms. Alana Officer from the WHO. Ms. Officer, given your experience at the global level, what health-related challenges related to population aging must be prioritized? How can Asia and the Pacific learn from other regions of the world, like Europe, which may be slightly ahead of us in the curve in facing population aging? Over to you, Alana.
Thank you very much, Dr. Sasa. And good morning to fellow panel members, excellencies, and ladies and gentlemen. So I think, as we heard from the really excellent presentation from Sabine, today's societies are not yet designed to support older people's health and well-being. And so, as we saw, we're seeing an increasing number of years spent in ill health. Again, COVID really highlighting those key gaps in policy and practice. So we need to prioritize 4 actions, and I think you've already heard them from our other 2 panel members, but I'm going to look at them specifically. The first one that Dr. Zhao just spoke to is tackling ageism. So we need to prevent and respond to ageism. There was a UN global report that was released last year that indicated that 1 in 2 people around the world are ageist, have moderate or high ageist attitudes towards older people. Ageism is incredibly harmful in terms of physical and mental health and has serious costs to individuals and societies. But we have looked at the evidence, and there are 3 strategies that work. Policies that prevent discrimination on the basis of age, and they can happen across all sectors. Education to have a more realistic attitude and understanding around aging, and intergenerational contact interventions. So there are examples of these interventions being implemented within the Asia and Pacific region and across the world. Ideally, these 3 interventions need to be implemented at the same time for the maximum impact. The second area, and we've heard a bit about it, is the importance of universal health coverage, but also particularly that within universal health coverage, older people receive person-centered and integrated care. Currently, our health systems remain ill-prepared to respond to the needs of older people. They still value hospitals over primary health care. They prioritize treatment over prevention. They manage single diseases over integrated approaches, and they still look towards cures rather than caring. So we need policies and we need incentives within our healthcare system to make this shift from acute care and infectious disease models, although they're important, towards models that actually address chronic diseases, that provide a continuum of care, promotion, prevention, rehabilitation, etc. And when we looked at experiences in countries across the board, whether it be Andorra, Australia, Brazil, China, Thailand, the UK, that are either implementing the WHO approach to integrated care or are working on improved integrated and coordinated care using other models. We've seen lower morbidity, a lower prevalence of unmet need, reduced number of emergency hospital visits, fewer replacements in residential care, increases in staff motivation and positive evaluations really from GPs, and improved performance of the systems at no cost. So WHO has a series of a framework for integrated care and guidance, but there are other models around there, and we need to continue to work on those and learn from them. The third area that we really need to invest on, and this has been raised by the previous speakers as well, is improvements in long-term care. Even before COVID, long-term care was under-resourced, neglected, and not well integrated with other parts of health and social care systems. As already stated, many countries in the region depend heavily on informal care, particularly by families and women. And so really investing in long-term care, including in paid and unpaid carers, needs to really be a priority for this region. It's an area, I think, where the Asia and Pacific region can learn from within the region and from others. In particular, there's not a country, there are pockets of really good practice across the world, whether that be through community-based care in Vietnam or some of the more institutional and home-based care, for example, in the Netherlands. But I think long-term care is really an opportunity where we all need to learn how to support aging in place and how to support people to live with dignity as they get older. So the last area is obviously improving health and well-being in older age requires a whole of society approach. And we've heard this already from the previous speakers, whether it be through labour, education, housing, social protection, transportation, technology. These need to work together. So a key priority for the Asia and Pacific region is really around making communities where older people reside much better places in which to grow older. So, and that means removing the physical and the social barriers and strengthening the policies and the systems and the services that foster health and well-being. So that includes obviously tackling ageism, integrated care and long-term care to be able to improve older people's ability to retain their own health and autonomy and continue to contribute to their communities. So, for example, the WHO Global Network for Age-Friendly Cities and Communities already supports more than 1,300 cities in 47 countries, covering about 300 million people, and therefore offer already large number of opportunities that can be shared within the region by cities and communities already becoming more age-friendly in the Asia Pacific region, with those that are also happening around the world. And there is quite a lot of guidance and support and hundreds of case studies of good practice that can be leveraged from anything from how to reduce social isolation, to put in park benches, to modify lights to be able to ensure older people can get out and about. So a large number of examples that we can draw from. So everyone's health is going to be improved if we reduce ageism, provide integrated care, build those long-term care systems for those who need it, and make our communities much more age-friendly. And these are 4 actions that are actually prioritised in the Decade Plan of Action. Thank you very much.
Thank you very much, Alana, for your very clear enunciation of the priorities, which, so we've had a very, very comprehensive and interesting first round of responses, which really laid the ground on country-level actions taken, the priorities, and what are the challenges, which allows us in the second round, Mr. Chair, to address our questions to the panelists. My first question of the second round to Her Excellency, Ms. Aishat Mahmood Didi, the Minister from Maldives, is the fact that under your guidance this July, the region adopted an outcome document to accelerate implementation of MIPA in the Asia-Pacific region. What can member states and stakeholders do to make the outcome more actionable in terms of how do we really take effective action to implement the outcomes, and how can member states, the UN and CSOs work together between now and the next review to really accelerate the implementation and to walk the talk? Over to you, Madam.
Thank you, Tata. As we concluded the 4th review in the appraisal of the MIPA, I think it was a very exciting day for all of us over there. We had immense constructive discussions. We learned a lot from each other, that panel discussions were quite fruitful. We reviewed all the countries' progress today to highlight some of the things I discussed in the concluding observations that day. For me, my understanding during those 3 days of deliberations was that a lot of work with regard to aging and the elderly population was comes from CBOs, which is good. It is really good. But I feel we need to, governments need to focus on policy, and we need to make aging and the plan of action a policy priority for all countries of this region and Asia Pacific and region. Without MIPA becoming a policy priority in the government strategic plans, including our own, we will always face challenges. This has to become a priority. So this is one of the things I would say, because unless we overcome the challenges, however much we emphasize that we need to learn from each other and that learning from each other should be a priority, we could talk about aligning MIPA, with the work we do. But unless the national development strategies and national development plans and the national budget for the actions in MIPA become a priority, we will face challenges. So I would like to use this opportunity to call upon all the governments in Asia Pacific region to make the actions in the action plan a priority in developing strategies, in developing national plans, and also when we put together our budgets. Let it be a special period of time so that between the fourth review and fifth review and appraisal, we achieve. We achieve, and we achieve big this time. So, this is what I would like to, because, we are talking about improvements in public health. Without investment, how do we improve that? We're talking about social and economic development and making life easier for the elderly, and at the same time making their lives a dignified life. This means investing in services for them that would make their life not a life that is confined to little space, which is their homes. We need to see our elderly active as much as possible. We need to see the aging population work together with the rest of the community. And for this, everything happens with money. And unless government's budget, government support, CBOs, NGOs, the challenges will continue to remain. So this is what I would like to, say once again. We want the concluding observations to be accelerated, and if we want MIPA's actions to be accelerated, governments, need to put in place policies that would create enabling environments and that would help CSOs to deliver the services. Because government cannot deliver the services. I believe the services have to be with the society, with NGOs, with groups who are working already. We need to support them. So, in conclusion, I would still like to, mention something I mentioned at the time, the role of the younger generation. We need to teach the younger generation to engage with the elderly. That engagement is what will make that large population we're going to envisage in 30 years' time or 10 years' time, 20 years' time, unless we engage with this population that's in school age now, unless we engage with the youth, we will not have the kind of image or society that MIPA envisages. The Madrid
Thank you.
International Plan of Action is actually 20 or more years old. But every time I go through the action plan, I feel whoever was involved in putting that plan, they are visionaries. Because a lot of the actions still are, in 20 years, usually plans become not relevant. But I still feel those are relevant actions that are there. Definitely new emerging trends such as climate change, the pandemics we faced, COVID, they may not be reflected there. But, and these need to be talked about in the next meeting. But let us today, once again, make a commitment as governments to make aging and plan of actions for aging a policy priority. And let's also, pave the way for CSOs to deliver services better and make them the service delivery wider. So once again, let me thank you for giving me this opportunity, and I will always be of support to bring about the conclusions from the fourth review and appraisal reality. Thank you very much.
Thank you very much, Madam Minister, for your really inspiring exhortation to all the member states here. Dr. Marianne Sao, you participated in the Madrid conference where MIPA was adopted. About almost 20, that was a long time ago, more than 2 decades ago. The plan of action asked member states to follow a bottom-up approach to its implementation and monitoring. Building on your experience, how can member states and stakeholders work together to make the outcome of the fourth review, again, more actionable? If you can just answer briefly and maybe succinctly in 3 minutes, ma'am.
Thank you. I really resonate with Madam Minister from Maldives mentioning. My experience working for the last 20, almost 30 years working with older people is that the ground-up approach is important because we are close to the community. We know what older people needs. We can innovate. We know what works and doesn't work. So actually it's important for us to be able to work with our policymakers so that we can actually help inform them better what the priorities are and what we can do to support them. I think in Asia, we don't have time to experiment so much. Singapore aged very rapidly, but we just happen to be ahead of the rest of people. Other countries like Maldives will also be aging very, very quickly. And we have our unique set of circumstances. So learning from each other is really, really critical. I benefited from learning from colleagues from in the US. And eventually while we're in Singapore, we're trying to build up our own ecosystem. We benefit from learning each other. And at the regional level, I'm pleased to say that we have been working across with other CSOs, other community groups in Asia. And recently we came together, formalized a coalition so that we can actually formally learn from each other. Because many service models work. Some people say, well, Singapore is an urban, fairly wealthy country, but actually the condition of human is not so different. And many low-tech solutions work very well in Singapore, just as work in Vietnam, and vice versa. So I would say that learning from each other is key, learning within our own country, working across regions and nations, because of different ways of practicing different innovations. And very much, we also appreciate the opportunity to work with our governments and as well as intergovernmental level to share that. So we can actually align the nation state's interests, Escap's interests, as well as our own. And within the community of CSOs actors, we can support each other in doing work in providing better care, better innovation, working better with other people, as well with our government. Thank you.
Thank you very much. I think you've really stressed on the need for the bottom-up approach and the need for us to really work together in this respect. My last question in this round is to Ms. Alana Officer. The UN Decade of Healthy Aging was adopted in 2020, and the decade complements the Madrid International Plan of Action and vice versa. How can Escap and WHO work together to build the synergies between both these documents and support countries so that they can implement both these commitments in a synergistic manner?
Hi, thank you very much, Dr. Tass, for the question. So obviously, MIPA and the UN Decade have the same goals, to improve the lives of older people, their families and their communities. So we need to raise awareness really of the complementarity and the synergies of MIPA and the Decade, but also leverage the sort of renewed energy and the fact that healthy aging has become a new health priority. But beyond raising awareness, I think that we need to do 5 things. We need to put people first. So older people must be visible and they must be central to all of the actions. And together, I think the UN can much better support the meaningful engagement and voice of older people in issues that concern them. And that requires some guidance and support for countries to be able to do that. We all need to be investing in evidence. Given the time constraints, the pressing needs, and that resources are limited, we need to invest in evidence of what actually works, both to foster healthy aging and to scale up MIPA. And that will enable, I think, governments and civil societies and private sector to make sound investments with the limited resources that exist. We need to partner much more together with champion countries and civil society. I think if Escap and WHO and the other agencies work together with champion countries, we would be better placed to leverage the strengths across the UN. I think in terms of, fourthly, we really need to continue to strengthen the collaboration across sectors and across stakeholders. You know, the Decade was always intended as a global collaboration that brings together governments and civil society, international organizations, private sector, philanthropy, media, etc., to foster health and well-being. We have already within the UN a joint plan for UN agencies which aligns with MIPA and leverages also investments being made towards MIPA for work around the Decade. Last year, we launched a UN multilingual knowledge exchange platform, so where anybody can share, find, and co-produce knowledge to foster healthy aging. So this provides a really important resource, and we can link, for example, Escap policies and data portals so that we're actually increasing access to the good practice in this region, also for others. Later this month, the WHO Director General will launch the Healthy Aging Collaborative, so a multi-stakeholder network that will enable these different stakeholders who have similar interests to come and to share information and to work concretely, really, on areas of common interest. And then I think, lastly, we need to focus our support at the country level and provide really practical solutions that are complementary in terms of supporting the implementation of MIPA and the Decade. And there we will be working much more closely together in terms of UN country teams to be able to help them raise awareness of MIPA and the Decade, the tools and resources that are available to support implementation. So there's, apart from awareness raising, which is important, 5 other things that I think that we can do together to drive action in countries.
Thank you so much, Alana, because you really have provided the framework for us to support the requests and the priorities that have been identified by other panelists. And also, I'm sure the member states raised these issues even during the 4th regional review. And it's essential that the UN system works together and provides appropriate mechanisms through interagency coordination and involving other stakeholders, whether it be governments and civil society, in sharing of information. And I think we got to be innovative in this respect. And thank you so much for outlining some of these critical issues. We have come to the end of this extremely interesting panel discussion, and I was extremely honored and really enjoyed moderating it, and I'm sure all of you enjoyed it as much as I did. So can I request for a hand of appreciation to all our panelists for their fantastic contribution. And I hand over the floor to you, Mr. Chair, conducting.
I thank the moderator and the panelists for the lively discussion and for sharing lessons learned and good practices in accelerating the implementation of Madrid Plan of Action in Asia and the Pacific. And now, pleased to open the floor for the country dialogue. Right. I invited the first speaker on this morning's list, the distinguished delegate of Timor-Leste, to speak to the floor, to take the floor, and to be followed by the distinguished delegate of the Maldives. Please.
Online. I thought the gentleman here was going to speak.
Are you here?
You have to see he's not here.
Okay, then if not, then I'd like to invite the delegation from the Maldives.
Yeah, she's online. Please unmute yourself. Can you ask them to unmute themselves, please?
Please unmute yourself, please.
Ask Timor-Leste.
So, okay, apology. So if Timor-Leste is already ready, please go ahead and proceed. Can you hear me? Joe, can you unmute yourself?
What happened now? They're having problem with audio.
So I think we still have some difficulty within the online connection. So I think we're gonna switch to on-site instead. So I think the first delegation that would like to request on-site is Malaysia. Please, Malaysia, take the floor. Thank you.
Thank you, Mr. Chair. Ladies and gentlemen, rapid aging will be a crucial megatrend affecting our region, including Malaysia, in the coming decades. And this brings new challenges in areas such as welfare, employment, income security, social safety net, and aged care. In promoting and protecting the rights of older persons, the National Policy and Plan of Action for Older Persons, adopted in 1995, are the guiding documents to push forward the aging agenda. As mandated in the policy, a National Advisory and Consultative Council for Older Persons was formed in 1996 to ensure a systematic approach to address the issues of older persons. Currently, a new action plan is being drafted to cover new challenges that our country is facing and to include development of a model to implement long-term care as well as the implementation of age-friendly cities. Now, realizing the importance of rights-based approach to protect older persons, the government has concluded a study on the content, approach, and scope in drafting a bill specifically for older persons, which was completed in October 2021. The rights of older persons will be further recognized once a new law on older persons is tabled in the first quarter of 2024. To encourage productive and active aging, the government has forged strategic collaboration with NGOs to establish activity centers for older persons based on community-based elderly care concept. The center provides older persons with the opportunity to socialize with peers and carry out activities including recreation, health screenings, and capacity building. As of June 2022, there are a total of 50,929 older persons participating actively at 153 activity centers nationwide. These activity centers are planned to be upgraded to become lifelong learning hubs. Lifelong learning is also encouraged through programs offered by various government TVET centers, including the University of the Third Age. Among the courses offered are religious studies, photography, arts, culinary, languages, and information technology. Malaysia recognizes the pressing need to discuss new emerging issues such as COVID-19 pandemic and digital transformation. As older persons are more likely to be digitally excluded and experience barriers in accessing online goods and services, the government is actively pushing for digital technologies to promote socioeconomic changes that empower older persons and better integrate them into the mainstream of development. Currently, every activity center for older persons are equipped with facilities to enable the patrons to join online trainings and workshops. Due to a growing number of older persons, it is necessary to create cities that are aware of the unique needs of all citizens, including the needs of the aging population. In this aspect, a smart city recognizes the role of technology and ICT in supporting older persons and accelerating the implementation of MIPA. The government is also concerned with the vulnerabilities faced by older women and is cognizant of the need to review policies that are not gender sensitive. Malaysia recognizes the importance to mainstream gender perspective in policies and programs related to older persons with a focus on gender dimension of aging, as this will be one area that the government will be focused on moving forward. Thank you, Chair.
Thank you, distinguished delegate of Malaysia. The next speaker on my list is the distinguished delegate of the Maldives, to be followed by the distinguished delegate of Iran. So please take the floor.
Thank you, Mr. Chair. Distinguished delegates, a pleasant good morning from the Maldives. Firstly, allow me to warmly thank the Economic and Social Commission for Asia and the Pacific for allowing me to say a few words and contribute to this discussion. I believe after the successful adoption of the outcome document with the inputs from the stakeholders, we are now in the process of implementing the outcome at national levels. Madrid Plan of Action provides a holistic and comprehensive global framework for the issues related to aging, and with the final outcome document, it is essential to align the discussions to our working processes. Maldives is working on reviewing the National Action Plan and aligning it with the outcome document and MIPA. Further, we would be also developing the monitoring mechanism to monitor and record the progress and achievements. This would be beneficial to continuing the work on aging, as we will be able to contribute to the global review processes of MIPA. We must note that this process is extremely important as we have limited data with regard to the situation of older persons in the country. Data related to emerging global trends such as COVID-19 pandemic and climate changes and the impact of this on older population is very limited. In order to align the national policy with MIPA, we are in the process of finalizing and processing the data from our nationwide assessment on the situation of older persons in the Maldives. This assessment will take into account the relevant data from all atolls in the Maldives and would aid in providing a holistic approach with regard to aligning the national policy and action plan with the issues highlighted in the outcome document adopted recently. As mentioned in the expert group meeting held in August, the aging process dashboard will also aid in accessing all available data concerning good practices and policies that are practiced in this region, and would enable us to carry forward and implement the outcomes at national levels. I am confident that this discussion will enable us to contribute and bring a way forward to ensure that population aging is considered and addressed at national level. And as we deliberate on addressing population aging and impacts that may hinder income security, healthy living, access to healthcare, supportive environments, access to digital services, and leaving no older person behind, I believe that with effective policies, investments, adequate and sustainable social security systems, we can together address these issues and achieve SDGs. Distinguished, I thank you for your close attention and for your sincere considerations. Thank you.
Thank you, distinguished delegate of the Maldives. The next speaker on my list is distinguished delegate of Iran, to be followed by the distinguished delegate of China. I now invite the distinguished delegate of Iran to take the floor.
Thank you, Mr. Chair. It gives me great privilege to address the 7th session of the Committee on Social Development. Mr. Chairman, the Islamic Republic of Iran is currently experiencing population aging at a rapid pace. In over 4 decades, the percentage of older people has increased from about 5% to 10% in 2022. And this rate will only increase in the coming decade. Population aging has a profound impact on societies, of course. It affects educational institutions, labor market, social security, health care, long-term care, and the relationship between generations, of course. Population aging may fuel opportunities for economic growth and spur countries to develop new fiscal approaches to accommodate a changing world. While some governments have begun to plan the pace of population aging to accelerate for the long term, most have not, and reforms become more difficult. The Islamic Republic of Iran has created a cohesive infrastructure by planning based on demographic and economic evidence to urge international collaborations and form a long-term strategy with both national and community-level implications. In this regard, Iran has been an active member in conducting the elements of Madrid International Plan of Action and has re-evaluated the implementation of the state plan over time. Mr. Chairman, the Iran National Document of Older People was officially announced and approved in 2021. The document consists of 6 major goals and several related strategies. Furthermore, the first draft of the National Bill of Rights of Older People has been prepared by the Councils for approval by the Senate in 2022. The first national survey on Iranian older population will provide a data pool related to the economic, social, and health-related aspects of quality of life. Since 2019, the Age-Friendly Cities program has been piloted in various major cities in the country, and the city of Isfahan has been included in the WHO Age-Friendly City Network in 2021. Currently, 6 other major cities have also started the process of making their cities more age-friendly. The Community-Driven Development Approaches program was initiated in Iran in 2021, which is a per-group-based local agenda for empowerment of all the people and facilitating their participation at the community level. This program has been introduced by the highly successful and award-winning team of Health Age International. Recently, 6 cities have started the pilot of this program under the supervision of the National Council for Older People.
Please
Exactly. So, Mr. Chairman, ladies and gentlemen, the road forward towards creating the proper means for participation of older people in development and betterment of the quality of life is hopeful. Significant achievements have been made so far, despite the external challenges ranging from unilateral coercive measures, including sanctions and the COVID-19 pandemic. In the meantime, treatment programs have been provided for around 4 million legal and illegal Afghan refugees. So a lot of achievements have been made during recent years. As a nation, we have the will to strive on and the knowledge and experience to pave the way forward. And we embrace an all collaboration and resources sharing with countries and United Nations organizations. Our main objective is the same: a meaningful and fruitful today and a hopeful tomorrow, respecting the dignity of all older citizens everywhere, and promoting all aspects of social inclusion for older people, to ensure their voices are heard, their rights respected, and their participation appreciated. Thank you, Mr. Chair.
Thank you, distinguished delegate of Iran. I now invite distinguished delegate of China to take the floor and to be followed by distinguished delegate of the Timor-Leste.
谢谢，尊敬的主席，各位代表。应对人口老龄化是人类共同面临的基础性的、全局性和战略性的问题。那么，中国政府高度重视人口老龄化的问题，将实施积极应对人口老龄化上升为国家战略。习近平主席也强调要把积极老龄观、健康老龄化融入到经济社会发展的全过程。那么目前呢，中国已经建立起了世界上最大的社会保障体系，基本医疗保险覆盖了超过13亿人，基本养老保险覆盖超过10亿人，初步建立了包括健康教育、预防保健、疾病诊治、康复护理、长期照护、安宁疗护6个环节的老年健康服务体系，持续推进国家基本公共卫生服务项目老年人健康管理服务，其中65岁及以上的老年人每年可免费获得1次健康体检，将老年人的疫情防控纳入新冠疫情防控的总体部署，全力救治病患，稳妥推进老年人新冠疫苗接种工作。那么截止到上个月，60岁及以上的老年人，在我们国家新冠病毒疫苗接种的覆盖人数已经接近了2.4亿，占总人口的90.44%。深入推进医养结合，为老年人提供综合连续的健康养老服务。截止到去年年底，共有医养结合机构6400多家，机构的床位总数达到了175万张。在老年友好社会环境建设方面，推进各领域各行业的适老化升级转型，实施智慧助老行动，努力解决老年人运用智能技术困难问题。那么下一步，中国政府将加快执行马德里老龄问题国际行动计划，坚持以人民为中心，重点在逐步提高养老保障水平，加强失能失智老年人的长期照护，维护老年人的合法权益，帮助老年人跨越数字鸿沟，促进老年人力资源开发，推动老龄产业发展等方面加强政策设计和服务供给。中方也希望与 Escap 成员国进一步的促进政策理念互学互鉴，扩大人才技术交流合作，共同应对人口老龄化，共建人类命运共同体。谢谢。
Thank you, distinguished delegate of China. I now invite the distinguished delegate of the Timor-Leste to take the floor and to be followed by the distinguished delegate of the Republic of Korea.
Hello.
Yes, this is good. Please go ahead, proceed.
Hello, Mr. Chairman. Can you hear me?
I can hear you. Please go ahead. Okay, I think
Hello, Mr. Chairman. Boris, can you hear me?
we can hear you well. Please proceed.
Thank you for the opportunity for Timor-Leste. We have 3 minutes only, so I would like to respond to the item number 4 of the agenda. I would like to share Timor-Leste information. We've been working to build a society for all age in line with the Madrid Plan for Action on Aging. I would like to reiterate that our Article 20 of the Constitution of the Democratic Republic of Timor-Leste guarantees special protection to its senior citizens. So since 2008, Timor-Leste has provided social protection to the elderly people by handing the subsidy of $30 cash per month per person. And in July 2022, the government has increased the payment to $50 per month to the beneficiaries. Of 103,000 senior citizens are benefiting from this program. Timor-Leste is also acknowledged that the problem with population aging, and we are right now has launched our housing and population census last month. and we are expecting that this number, currently over 1.3 million population, probably this number will increase after the census data will be launched in October. So with the view of improving better enabling and supporting environment for country's senior citizen, Timor-Leste will refer to the Madrid International Action Plan on Aging and other relevant documents to guide the formulation of forward-looking policies and action in Timor-Leste. We also welcome the recommendation on the accelerating implementation of the Madrid International Plan of Action for Aging 2002. Finally, let me reiterate that Timor-Leste's commitment to work closely with various partners in the region, particularly with the Escap, to build a better and more productive environment for senior citizens in the country and also in the region. We acknowledge very important messages from the panel members. Thank you for the best practices that you share with us. Timor-Leste, we are very happy to learn the practices and also from other countries and anticipate in our own policy planning and also budget allocation, as Maldives pointed out rightly. We are also looking at the opportunity on how can we make use of our youth. Our population, the youth is very, very high in this country, and we also have several informal care by families. We are also looking into the future, how can the youth contribute, and we are looking at the program of how can they contribute their time, and the time will be discounted in the future. I think that's all for now from Timor-Leste. We look forward to work with you all. We look forward to learn the best practices from the countries in the region. Thank you.
Thank you, distinguished delegate of the Timor-Leste. I now invite distinguished delegate of the Republic of Korea to take the floor and to be followed by the distinguished delegate of the Philippines. Please unmute yourself.
Can you hear me?
Very well. Thank you. Please.
It's my great pleasure to be here in this meeting on behalf of the government of the Republic of Korea. Due to the rapid aging of population, Korea is expected to become a super-aged society where people aged 55 years or more exist 20% of the total population by 2025. The increased proportion of this age group means a person can expect a longer life in old age in one's lifetime, as the average life expectancy in Korea is 83.9 years. Considering this, we are promoting various policies in various fields, such as job security, income security, health and caring, so that people can live a healthy and active life in old age. Thus far, policies for older persons have been mainly limited to the areas of long-term care and welfare. However, a new older age group, the baby boomers generation, has affected diversified policies. Relatively healthy older citizens with high education and income levels want continued social participation and various types of jobs. In addition, they want to stay in their own homes and communities as they age, with high-quality home care services rather than staying in nursing homes or hospitals. I'd like to highlight 3 of our policy directions. First, to ensure stable retirement income, we are providing the national pension and basic pension benefits for older people. Also, to provide high-quality jobs, we plan to increase the number of jobs and offer various types of jobs, including social service and market-linked jobs, in addition to simple jobs. Second, considering the increasing burden of caring costs, by the aging population, we are also seeking ways to improve the sustainability of care policies for older persons. We will delay nursing homes entry with better preventive services and improve home-centered care services so that people can grow old independently in their own homes. Through public care services for older persons living alone, regular visits and phone consultations will be provided to check their safety and conditions. Lastly, we plan to provide a better health services and caring for older persons in response to the spread of infectious diseases such as COVID-19 and environmental deterioration such as air pollution. We also plan to improve the facility environment in nursing room by upgrading ventilation and facilities for infectious disease prevention and control such as isolation rooms. Furthermore, the remote safety and health management using ICT will be implemented to ensure caring services for older persons during the pandemic. As all sectors of society are rapidly digitalizing, older persons may have difficulties in their daily lives that require the use of digital devices. Providing digital education, we will expand institutional support for the development and promotion of products that will be easier for older persons to use. The government of the Republic of Korea will continue efforts to build an age-friendly social system by preemptively responding to demographic changes. We will always pay attention and be open to the opinions and directions suggested by the UN Escap Committee on Social Development. Thank you.
Thank you, distinguished delegate of the Republic of Korea. I now invite distinguished delegate of the Philippines to be followed by Indonesia. Please take the floor.
Thank you, Mr. Chair. More than ever, our resolve to improve the enabling policy and program environment for the empowerment of our older persons, their families, and their communities has never been more determined than now, given the steadily growing population of our older persons. Based on our 2020 census, our senior citizens, or those aged 60 years and above, have now reached 9.22 million, or 8.5% of our total population. While we have yet to approach an aging population, this demographic structure calls for the institution of relevant policies and programs to ensure the well-being, capacities, capabilities, and continued productivity of our older persons now and in the future. Our trust and commitment of empowering our older person is aligned with the Madrid International Plan of Action on Aging, which is nationally translated into our Philippine Plan of Action for Senior Citizens. Our main policy framework for senior citizens is embodied in our Constitution, mandating Filipino families to take care of its elderly members and the state to design programs of social security for them. To enable this constitutional mandate, we have the expanded Senior Citizens Act of 2010 that provides various privileges and services for older persons, our Universal Healthcare Law, which gives preferential treatment to older persons in the provision and access to necessary and timely health care, our Republic Act number 11350, which created the National Commission on Senior Citizens to ensure the full implementation of laws, policies, and programs of the government pertaining to senior citizens, Republic Act 7432, which mandates the establishment of the offices of Senior Citizens Affairs in cities, municipalities to ensure the implementation of local policies and programs for them. And our Bayanihan, We Heal as One Act, which mandates local government units to facilitate the distribution of social pension for indigent senior citizens during the time of the pandemic. Moreover, the Commission on Population has organized the Committee on Active and Healthy Aging to study policy solutions for the well-being and development of older Filipinos. The country is also promoting the continued productivity of our older persons through their participation in income-generating work by institutionalizing support mechanisms and policies such as the anti-age discrimination in employment law, among others. Continuing policy discussions are underway to rationalize the retirement age in the country to balance opportunities to earn income as well as the well-being of older persons. Filipino older persons continue to experience functional difficulties and socioeconomic challenges. Almost half of our older Filipinos find it most difficult to walk around and leave the house and stand up or sit down. Most of them suffer from diagnosed illnesses and are also incapacitated from accessing timely healthcare services.
Distinguished delegate, the time is coming close, so may you please wrap it up?
We are currently pursuing the institutionalization and localization of our social protection floor, which includes programs that guarantee the healthcare and income security of senior citizens, among others. Within the full devolution policy being implemented in our country, local government units are mandated to develop and implement interventions for older persons. Together with the rest of our countries in the Asia and the Pacific and in the entire world, we remain committed to promote the objectives of the Madrid International Plan of Action on Aging within the Philippines. We shall proactively pursue international collaboration such as South-South cooperation schemes with other countries in creating societies that uphold the rights of older persons and empower them to live an independent, healthy, long, and active lives. Thank you very much.
Thank you, distinguished delegate of the Philippines. I now invite distinguished delegate of Indonesia to take the floor, to be followed by distinguished delegate of Bangladesh.
Thank you, Chair. Indonesia has mainstreamed the implementation of the Madrid International Plan of Action of Aging in the Asia and Pacific through the enactment of the President Regulation Number 88 of 2021 on the National Aging Strategy, which is set up to the development of and focus on the consumption, services, and productivity for the older group in the digital world, especially during the disruption of the COVID-19 pandemic. The national program to support and improve the well-being of older people include the Older People Family Welfare Program, providing conditional cash transfer to the elderly, the local community-based social welfare in the elderly, offering health services, and the social rehabilitation assistance for the elderly attention based on family, community, and residential-based approach to fulfill the proper need to the elderly to ensure health, social care, social assistance, and accessibility. Currently, statistical data on the elderly is available according to gender, income, class level, health, and housing obtained through the routine survey data collection activity in the household level. However, we are still improving the microdata in order to ensure the assistance distribution based on the name and address. The government is a development the Social Economic Registration System, or REXOSEC, to be implemented at the end of the 2022 and 2023 data collection from the registration system is expected to provide best data for the distribution of the elderly assistance. To ensure access to information, communication, and technology for the elderly, strategic action are needed for partnership with digital-based health services and other digital platforms to provide online-friendly access to the elderly living in the remote area, not only for health consultation, but also to fulfill the elderly basic need. Indonesia is committed to going beyond economic growth in achieving welfare and equality, as well as to accelerating SDGs agenda, with the priority to ensure the social protection of the older population. Thank you.
Thank you, distinguished delegate of Indonesia. I now invite the distinguished delegate of Bangladesh to the floor, to be followed by distinguished delegate of India.
Honorable Chair of the session, Excellencies, ladies and gentlemen, very good morning. I express my sincere gratitude and thanks to the Economic and Social Council for Asia and the Pacific for hosting this prestigious event. Honorable Chair, I would like to share some sort of information in aspect of today's agenda. Population aging and its social economic consequences are drawing increased attention of policy makers worldwide for Bangladesh too. Aging is one of the emerging issues that has been gradually accumulating with the far-east consequences. In these regards, National Older Person Policy has been formulated in 2013 and an implementation work plan of the policy also introduced in 2015 in line with the Madrid International Plan of Action on Aging. The policies and work plan is now introduced in implementation process focused on aging. In our country, the older persons are honored, declaring by the state as senior citizen. For the better caring and protection, the Maintenance of Parents Act 2013 is enacted. The Constitution of Bangladesh guarantees of social protection for the backward person, especially by first segment of the population. In particular, the Article 15D of the Constitution clearly spells for social security for older person. Bangladesh is the 7th most populous country in the world and is also the phase of rapid demographic transition. In Bangladesh, elderly population is defined as those who have reached 60 years of age. According to the population census 2022, the population size is 165 million, and out of these, 9.3% is the age of 60 years. The government of Bangladesh has embarked upon the formulation of the comprehensive national social security strategy focused on aging and the 2030 agenda of SDGs. Mr. Chair, housing and healthcare is the emerging problems of Bangladesh. Every few members of NGO lead home in the country. On the other hand, 6 government old homes in the country, their accommodation is 50 is home. There is also provision of 10 older person accommodation in 85 government children's home. Mr. Chair, old age allowance is the largest social safety programs in the country. Under this program, 5.7 million older person is receiving old age allowance. Mr. Chair, Honorable Prime Minister Sheikh Hasina, considering the great contribution of the freedom fighters, introducing allowances for freedom fighters, they are receiving 20,000 BDT in every month. Besides this, government has
Time is running out, so may you please wrap up the statement.
Allowance and allowance for persons with disabilities also. Also, the social safety programs for the marginalized people in our country. Very recent, some important positive initiatives have been taken, which are as follows. A web-based MIS has been established and about more than 8 million beneficiaries data
please
is
wrap
stored.
up, please.
Reducing time, cost, and visit beneficiaries payment system is digitalized. Now the older person can receive money from their doorsteps through mobile financial service. Established 8 old home in a division is working. A draft National Pension Authority is to 2022. Reservation of seat in the public transport is activated. Honorable Chair, I would like to conclude if we ensure the active participation of NGO and GO with positive approach to address the emerging problem of older person, the life will be more secure. Thank you all.
Thank you, distinguished delegate of Bangladesh. I now invite distinguished delegate of India to be followed by distinguished delegate of Pakistan. Please take the floor. Please unmute yourself. Delegation from India.
Thank you. I think it is audible.
Yes, please.
Good morning to Mr. Chair and Excellencies, distinguished delegates. Thank you very much. You have given opportunity to speak here. The elderly persons in the society constitute an important element of nation building process. They have rich experience, wisdom, enthusiasm, and ability to contribute to the society. Respect to the elders, therefore, is one of the basic tenets of the Indian culture. The Indian family system has historically taken care of the elderly in the household, and therefore it has acted as the social security net for the elderly. National policy on older persons announced in 1999 envisages state support to ensure well-being of the elderly. The Maintenance of Welfare of Parents and Senior Citizen Act was enacted in 2007 to provide effective provisions for the maintenance and welfare of parents and older persons above the age of 60 years who have been defined as senior citizens. In India, the size and percentage of the older persons population have been increasing at faster rate in recent years, and the trend is likely to accelerate in the coming decades. The substantial increase in life expectancy is because of advancement in technology, healthcare facility, and improvement in the economy. The changing demographic profile, the change in family system, the need to build livelihood for the elders, and the rise of the private providers for the elders have created newer challenges and opportunities in the country. Therefore, we are in the process to revise the existing policy. The new national policy for senior citizens, which aims to create a society in which senior citizens live a healthy, happy, empowered, dignified, self-reliant life, along with strong social intergenerational bonding. To achieve this vision, India has already taken many initiatives to take care of senior citizens. The existing act is proposed to be amended, taking into account consideration the feedback received from all the stakeholders. An IT platform has been developed for the purpose of bringing the employment seeker, that is senior citizens and employment providers in the country. Many senior citizens have experienced time and energy which can be used by the business enterprises looking for stable employees with experience. The IT portal allows bringing these people together by virtual matching of preferences. The program was launched on 1st October 2021. Senior citizens are encouraged to form elderly self-help group, which will provide them with a platform to share the time constructively with each other. In order to provide an IT-based solution for resolving grievances of the elders, a national helpline called Elderline, short code 14567, was launched on 1st October 2021. There are destitute elders who require support of the old age homes. The government has taken the responsibility of opening one old age home in every district, which will be fully funded by the government and run by NGO Trust Society. The Social Security Net for Elderly has been one of the biggest programs of the government in India. Both union and state government have together identified millions of elders who have received pension from the government on monthly basis through direct transfer mode. Healthcare for elderly is one of the pious duties of the state. The national program for healthcare elderly has been started.
Please wrap up your statement, please.
Yes, the country launched a scheme named Rashtriya Vaishri Yojana, which is national program for providing assisted living devices free of cost to senior citizens. Private sector has been active in creating product and service meant for the elderly. We promote silver economy. We recognize the contributions made by individual institutions and non-government organizations for welfare of elders in the country. National award called Vaishri Saman are given to the such eminent senior citizens institutions on International Day of Older Persons, that is 1st October every year. Taking care of elders has to be national program where the government, non-governmental organizations, private sectors, facilities and society at large, including children, should participate actively. We can achieve the vision of society in which all the senior citizens live a healthy, happy, empowered, dignified and self-reliant life along with strong social intergenerational bonding. This is possible by taking all the required initiatives based on trusted information, details, and experience we share here with each other. Best wishes to all the participants. Jai Hind.
Thank you. Thank you, distinguished delegate of India. I now invite distinguished delegate of Pakistan to take the floor, to be followed by distinguished delegate of Cambodia.
Thank you very much, Mr. Chairman, for providing me the opportunity to speak on efforts of Pakistan to improve the status of older person. While looking at Constitution of Pakistan, it has very high value, respect and dignity for older person and followed a defined agenda for their dignity and respect. The guiding principles for their protection includes equality, principles of non-discrimination, and taking special measures to ensure their protection and are embedded in the Constitution of Pakistan. Pakistan is one of those 15 countries where population of people over 60 years of age is over 10 million. Currently, there are 14 million people over 60 years in Pakistan, which will be increased to 43 million in 2050, making 15.8% of the total population. Elderly persons are vulnerable to violation of their rights, including rights to security, rights to health care, rights to an adequate standard of living, rights to non-discrimination on the basis of age, rights to participation, rights to be free from torture or cruel, inhuman or degrading treatment. People sometimes take advantage of the vulnerability of elder people. Elderly women particularly are at the greatest risk for having their rights violated. In general, women are historically more vulnerable towards violation and violence due to their traditional subordinate position in cultures. Mr. Chairman, the government is effectively addressing the issue of economic empowerment, and a relief package for older persons was announced in 2004, which provides basic needs of life like special treatment at hospitals, railway stations, airports, and banks, besides concessional legal facilities like free entry to public parks, museums, zoos, and public libraries throughout the country. To address the educational need, Allama Iqbal Open University offered distance learning courses to people of all ages. Similarly, Employees Old Age Benefit Institution, EOBI, provides monetary benefits through various programs such as old age pension, invalidity pension, survivor pensions, and old age grants. National Saving also provides Behbood saving certificates and pensioner benefit account to fulfill the financial need of the senior citizen. Islamabad Capital Territory Senior Citizen Act has been promulgated in 2021, which protects the rights of senior citizens at capital level. And awarded certain privileges includes concession of their prescribed rates of medicines and tax exemptions to the senior citizen of Islamabad. Similarly, provincial governments of Khyber Pakhtunkhwa, Sindh, Balochistan have also promulgated their laws and introduced reform packages and intervention to ensure the welfare of the older person in the provinces. Pakistan Baitul Mal, on the other side, has also established great homes for senior citizens at each provincial regional headquarters. Moreover, Afiyat administered by Social Welfare Department, Eidi Foundations of Old Homes, Happy Homes, the Senior Citizen Foundation, Senior Citizen Welfare Program, Pakistan have also been providing welfare and rehabilitative services to the older people in Pakistan. Mr. Chairman, despite all measures, serious efforts are required.
Time is running out. Please wrap up the statement.
Okay, thank you. Despite all measures, serious efforts are required, and it is the basic responsibility of the government as well as the society and the families to provide dignified life free from exploitation, mental and physical abuse to its senior citizen. They feel comfortable in their home environment with their children and grandchildren. Therefore, the family support system needs to be strengthened by providing economic incentives such as tax exemptions and special privileges to families who are taking care of their elderly members. The practical measures taken by Pakistan demonstrate its strong commitment to protect, promote, and empower senior citizens to become equal and dignified citizens. The government of Pakistan is fully cognizant of the commitment under the Madrid International Plan of Action on Aging and playing its role in its realization, the dream of making Pakistan where human rights of older persons are fully promoted and protected. I thank you very much.
Thank you, distinguished delegate of Pakistan. I now invite distinguished delegate of Cambodia to take the floor, to be followed by international organization now, International Federation of Aging. Please take the floor.
Your Excellency, Chair, and distinguished delegates, Cambodia has an estimated 1.2 million elderly people. In 2019, there was 8.9% of the population were aged 60 years and above. It is estimated that by 2030, elder people will comprise 10% of the total population. The number of elderly people will increase to about 5 million by 2050. This trend implies that over the next few decades, a potentially shrinking working age population will need to support an expanding elderly population. Respect and care for the elderly are integrated in Cambodian Khmer culture. In this spirit, ensuring a high quality of life for older persons is always among the government strategy priorities. The Royal Government of Cambodia has adopted the National Policy on the Elderly 2017-2030 and its National Action Plan 2021-2025 to take care about the health, well-being, and needs of the elderly people. The policy is creating an enabling environment and support system for the elderly based on the principle of inclusiveness, equity, efficiency, and sustainability. Furthermore, the National Social Policy Protection Framework 2016-2025 has also been adopted, highlighting the need of the vulnerable people, including the elderly, as there are little opportunity to earn a living and work. Despite this effort, there is a long way to go in enhancing the elderly care service and protection. Many of Cambodia's citizens are struggling when they reach old age. Many of them are not unable to work due to disabilities and sickness and home care responsibility. The situation deteriorates as people age further, with those over 75 years of age experiencing the highest level of vulnerability, especially elder women. COVID-19 have made elder people even more vulnerable, with more than 55% of them affected the income generation. The research report on the income of the elderly and social protection in Cambodia during and after the outbreak of COVID-19 show that the support of the elderly is still lacking, with only about 45% of the elderly receive cash support during epidemic, and the majority of the elderly need provision of benefit to sustain their livelihood and more intervention to improve their well-being so that they do not fall into poverty or vulnerability. The Royal Government Cambodia continue to work closely.
Time's running out. Distinguished, please wrap up.
The way forward, the Royal Government Cambodia is working with UNDP, UN Escap, development partners, and civil society organizations to enhancing the elderly health care and pension system. For example, one, conduct a scoping study on feasibility study and costing option for extending free health care to elderly. 2, develop a multi-tier pension system under social protection policy framework. And 3, conduct a feasibility study on multi-tier pension system, demonstrating the need to bring the contributory and non-contributory scheme together. I thank you for your kind attention.
Thank you, distinguished delegate of Cambodia. Now invite International Federation of Aging to take the floor, and will be followed by Foundation for Older Person Development. Thank you. Please take the floor.
As an international non-governmental organization whose membership base comprises government, civil society, industry, academia, and individuals, the International Federation on Aging appreciates the opportunity to provide a statement at the 7th session of the Committee on Social Development towards the agenda item follow-up to the outcomes of the Asia-Pacific Intergovernmental Meeting on the 4th appraisal and review of the Madrid International Plan of Action on Aging. Reflecting on the outcomes of the recent review of MIPA, there is a clear overlap in priorities and a high degree of alignment can be seen between these priorities and the key action areas of the UN Decade of Healthy Aging. As such, a real opportunity exists to leverage the momentum and strategic approach of the decade towards the shared success of both of these important initiatives. The UN Decade of Healthy Aging is a timely and unprecedented global collaboration that brings together governments, civil society, international agencies, professionals, academia, the media, and the private sector to improve the lives of older people, their families, and the communities in which they live. Foundational to the successful implementation of the decade, which is not only aligned with MIPA, but also builds upon and responds to other global commitments and calls for action, is the need for strong multi-sectoral and multi-stakeholder collaboration. As Dr. Tedros, Director General of the World Health Organization, has stated, to foster healthy aging, we need to work together. This must be our new normal. Aging connects with a wide range of technical issues addressed by the WHO and the UN. And while there are a number of mechanisms currently underway to help facilitate collaboration across diverse stakeholders, there is currently no real mechanism to support and facilitate the collaborative efforts of civil society. We have collectively, as a result, struggled to make the necessary connections with the specific technical units to both inform WHO and UN programs, and also facilitate work at a country level. Connecting stakeholders, hearing their voices, and being authentically engaged are the foundations required to drive agendas to improve the quality of life of older people around the world. Policies impacting the lives of older people cut across many governmental portfolios. However, common cross-cutting policy agendas that draw on evidence from all levels of government rarely make the necessary connections and linkages for a comprehensive plan of action. Accelerating impact and actions associated with these plans ultimately requires policy coherence throughout. CSOs can play an important role towards fostering policy coherence by ensuring that the real-life experiences of current and future generations of older people is evident not only in the policies themselves, but also in the way progress is measured. Civil society organizations working together represent a defining force that can help influence and shape policy. Together, we play a pivotal role in reinforcing the need for strategic action across sectors, disciplines, and government ministries, with a common goal of improving the health, in the broadest sense, and the well-being of older people. Strong leadership that includes civil society is essential in realizing both the Madrid International Plan of Action and the UN Decade of Healthy Aging for current and future generations of older people. Strong leadership that includes civil society is essential in realizing the potential of both the Madrid International Plan of Action on Aging and the UN Decade of Healthy Aging for current and future generations of older people.
Thank you, IFA, for your recording message. I now would like to invite Foundation of Older Person or Development to take the floor and to be followed by Gravis.
Good morning, respected Chair. I'm Usa Kiorot, representing the Foundation for Older Person Development, a national NGO in Thailand. In many countries, ageism and age discrimination are widespread and socially accepted. In Thailand, the prohibition of ageism is not explicitly included in the Act on Older Person, and is a widespread of age discrimination in employment, and the inclusion of upper age limits is common in job advertisement, despite government efforts in promoting employment for older people. Older men, older women are significant contributors to society, but negative perception and age discrimination prevent them from fully participating and contributing to development. The national survey conducted as part of the 4th Madrid International Plan of Action on Aging review in Asia and the Pacific identified misperception and stereotypes about older people and population aging as one of the top 3 challenges for the implementation of this MIPA. Ageism is a root cause of many other challenges. Not being able to tap the potential of this fast-growing older population is a huge loss for societies. Combating ageism and age discrimination should be one of the priorities for the governments and stakeholders in accelerating the implementation of MIPA. There have been several good practices in the region that can be promoted and scaled up. Using an inclusive intergenerational approach which will facilitate interaction between younger and older generations, which has been proven to be effective in reducing and preventing ageism. Apart from addressing ageism, this organization can also act as local mechanism for older people to collectively address their own challenges and the community in which they live. To achieve a society for all ages, young, older people, women and men must be treated equally and have equal
Could you please help
opportunity
wrapping up? We
to
shortly time.
contribute and benefit from development regardless of their age. Thank you.
Thank you, FOBDEF. For now, I'd like to invite distinguished delegate from Gravis to take the floor, and next to be followed by area.
Thank you, Mr. Chair. Good morning to all. It is heartening to see that the aspects of aging are getting important space and attention in the 7th Commission for Social Development discussion and dialogues. Recently held stakeholder consultations in the IGM for the of NEPA were very fruitful with active participation of various entities, including a number of CSOs, such as the CSO that I represent, named Gravis. Those discussions brought some important perspectives. As challenges faced by the CSOs, it was agreed that there is an overall dearth of CSOs working in the aging sector due to various reasons. Secondly, it was noted that older people in remote rural locations are difficult to reach by with geographical challenges. And thirdly, it was felt that limited literacy among older persons is a major problem, causing their limited engagement or marginalization in various programs. As good practices led by various CSOs, the work around older people's groups was recognized towards strengthening older people's agency. Also, there is some very impactful work undergoing in the care domain related to self-care, home care, palliative care, and mental health, and so on. I would also like to remind some of the important recommendations discussed to strengthen aging-related work. Those include to further strengthen older people's agency. Secondly, to bridge the digital divide, which will connect more older people to processes and programs. And thirdly, to take stock of existing good practices and replicate them as much as possible in as many locations as possible. However, in order to do the above, there is a strong need of having alliances in which CSOs will have active roles. And therefore, I urge member states to envision alliances with CSOs at national levels, perhaps regionally, in which CSOs can take active part. CSOs in this process will have an active role moving forward. Thank you very much for the opportunity.
Thank you, Gravis. I now would like to just request the member state that if we could allow 2 more speakers to follow. If no objection, we would request his permission. So thank you. So we will allow 2 more speakers to follow. So I would like to invite area to the floor and followed by Development Welfare Research Foundation. 2 minutes, please.
His Excellency Chair, Excellency distinguished delegation, on behalf of the Economic Research Institute for ASEAN and East Asia or area, I'd like to extend my deepest gratitude for giving us to speak in this important committee. As a think tank in the ASEAN region, AREA has conducted a variety of studies on aging issues in Asia. For that reason, I was honored to serve as a resource person in stakeholder consultation during this appraisal and review process of the Madrid International Plan of Action on Aging in this region. AREA is pleased to see the final document at this committee and today's active discussion. I'd like to express my sincere respect to all those involved, including Escap Secretariat. In the outcome document, the importance of effective quality data collection and regional research is stated, and the AREA would like to emphasize this point. AREA has conducted studies in collaboration with many partners, including UN agencies, governmental organizations, and universities, while longitudinal studies of elderly people in the Philippines and Vietnam are 2 of our best published outcomes. Those studies have shed light on the comprehensive living circumstances of elderly in both countries, including health, economy, and lifestyles. And the delegation from the Philippines in the intergovernmental meetings has mentioned this importance of this study as a valuable resource for crafting the policies. As all data sets of the Philippines study in 2018 have already been released to the public for academic use, we hope that data will be utilized by as many people as possible. Notably, the study revealed that significant elderly suffer economically due to poverty, in particular females, and thus have limited access to healthcare services. Further, over other area research indicates that older people in this region face a host of gender, poverty, health, disabilities, and other challenges, all those in agreement with the outcome document. In order to overcome those challenges, the area recommends to develop policies to promote active aging and community-based care. Lastly, area will continue to provide quality evidence and policy recommendations to support member states for implementation of the Madrid Plan of Action. We look forward to collaborating further with all of you here. Thank you very much for your attention.
Thanks, Area. I now like to invite the Development Welfare Research Foundation for 2 minutes, please.
Thank you, Chair. While forward-looking policies and government action to address the challenges and maximize the opportunities of aging have been put in place by various governments, yet, to my mind, what seems an overlook is strong and urgent emphasis on improving the images of older people in society. Stories of their resilience, their determination, their survival, and their coping mechanisms hardly find space in popular media and public domain sources. Yes, varied measures have been taken by stakeholders to promote the active participation and inclusion of older persons in all aspects of life. But the criticality of this is that the recognition of older persons as partners in development is a nascent stage. For instance, I find as a researcher hardly any instances where the contribution of older persons to the economy is applauded. Many older men and women workers, but where are the calculations of their labor, the work hour inputs, and its relation to shaping the economy? Where is the documented appreciation? Many older men and women are caregivers and significant contributors to reducing the cost of care on the society. Yet, not only are their roles undermined, but not enough initiatives taken to enhance their contributions to the household and wider economy. Focus on developing silver economy has caught the attention of the government and the private sector. However, to speed the implementation and upscale programs to give more visibility to the aging sector is nonetheless slow. There is growing data on increases in population aging.
Please wrap up.
At the same time, determining how the longer life expectancies are an asset to society is limited. Economic data linked to social, health, and environmental determinants needs wider visibility. I make a plea for giving due recognition to the things I have stated. Thank you.
Thank you, Development Welfare Research Foundation. So now I think we come to the close. So thank you for your informative statement, which have provided further insight into how member states are implementing the Madrid Plan of Action in the region and how we member states, stakeholder and United Nations entity can work together to build a sustainable society for all in Asia and the Pacific. The country intervention from delegation of this session highlighted the need for appropriate coordination and support mechanism for the implementation and follow-up to the outcome of Asia-Pacific Intergovernmental Meeting on the fourth review and appraisal of the Madrid Plan of Action. On this basis, I hope that the committee can agree to request Secretariat to explore appropriate mechanism to support interested Escap member and associate member state civil society organization, and organization of older persons operating at the regional and sub-regional level in Asia Pacific to support the implementation and follow-up to the outcome of Asia Pacific Intergovernmental Meeting on the fourth review and appraisal of the Madrid International Plan of Action on Aging. I also suggest that the committee call upon Escap member and associate member to strengthen existing network of the national focal point on aging and provide on voluntary basis regular update to the Escap Secretariat on policy, action plans, and monitoring framework to facilitate sharing of experience and knowledge at the regional level. And I understand that these will be shared in the dashboard of policy and good practice on aging available on Escap website. If any delegation wishes to raise an issue, I see. Thank you. Okay. As I see no further comment, I propose that the Secretary reflect this comment in the decision of this committee to be presented in the draft report of the committee in agenda item 4. This is now conclude our deliberation of the morning session. We will then resume the committee at 2 p.m. in this room as well as on Kudo on YouTube to consider agenda item 5, review of the implementation of insurance strategy to make the right reals for persons with disability in Asia Pacific. Before we adjourn for lunch, I would like to invite Secretary to provide some housekeeping announcement, if any. Okay. I see there are none, and declare this meeting adjourned. Thank you.
Start now the day 2 afternoon session of our conference. Excellencies, distinguished delegates, ladies and gentlemen, we will now turn on agenda item 5. The background document for this agenda item is review of implementation of insurance strategy to make the right real for persons with disabilities in Asia and the Pacific, as put forward in the background document Escap/CSD/2022/4. I would like now to invite the Secretariat to deliver its presentation on agenda item 4, a review of the implementation in Incheon strategy to make the right real for persons with disabilities in Asia and the Pacific. Ms. Chai Chai, please. The floor is yours.
Thank you, Madam Chair. Excellencies and distinguished participants, I'm pleased to provide an overview of the implementation of the Incheon strategy to make the right real for persons with disabilities in Asia and the Pacific. Asia Pacific is a home to more than 700 million persons with disabilities. In 2012, Escap member states proclaimed the Asian and Pacific Decade of Persons with Disabilities, 2013 to 2022, and adopted the Incheon strategy to make the right real for persons with disabilities in Asia and the Pacific. The Incheon strategy comprises the world's first set of regionally agreed disability-specific development goals. In 2017, the Beijing Declaration, including the action plan to accelerate the implementation of the Incheon strategy, was adopted at the high-level intergovernmental meeting on the midpoint review of the disability decade. The Beijing Declaration and Action Plan provides further policy guidance on advancing disability-inclusive development. As you can see on the screen, the Incheon strategy consists of 10 goals, 27 targets, and 62 indicators to measure progress towards disability-inclusive development. It comprehensively covers essential issues such as employment, social protection, and education that impact the well-being of persons with disabilities. The Beijing Action Plan delineates strategic policy measures in connection with each goal of the Incheon strategy. In view of the inherent synergies with the CRPD and the 2030 Agenda for Sustainable Development, the Incheon strategy and the Beijing Action Plan provide a unique set of tools to support the realization of inclusive and sustainable societies. This year marks the end of the disability decade. Escap is leading a comprehensive review of the implementation of the decade. The process includes an analytical review and consultation meetings, culminating in the high-level intergovernmental meeting on the final review of the Asian and Pacific Decade of Persons with Disabilities, 2013 to 2022. The analytical review aims to examine the state of disability-inclusive development in Asia and the Pacific, based on survey responses from 31 governments, 24 civil society organizations, and 8 international organizations, as well as existing reliable data. We have found that most of the Incheon strategy goals have not been met. Outcomes of the expert group meeting and stakeholder consultation resonate with the findings of the surveys. There is an urgent need to accelerate the implementation of the Incheon strategy and the Beijing Action Plan. The high-level intergovernmental meeting will be convened from 19 to 21 October 2022 in Jakarta, Indonesia, and online. The meeting will review the progress and challenges in the implementation of the disability decade and the Incheon strategy, and discuss forward-looking policies and strategies concerning persons with disabilities. This high-level intergovernmental meeting is expected to adopt the Jakarta Declaration on the Asian and Pacific Decade of Persons with Disabilities, 2023 to 2032, to guide regional efforts towards realizing disability-inclusive development in the coming decade. The Secretariat is also inviting Escap members and associate members, civil society organizations, UN entities, and other stakeholders to organize side events to enrich discussions and outcomes of the meeting. 4 roundtables will be organized under Agenda Item 3, which centers on forward-looking policies and strategies for disability-inclusive development in the coming decade. The first roundtable will focus on how governments can harmonize their national legislation with the Convention on the Rights of Persons with Disabilities, following its ratification of CRPD. The second roundtable will discuss strengthening multi-sectoral partnerships and exploring innovative modalities for fostering partnerships among governments, private sector, and organizations of and for persons with disabilities. The third roundtable will address the latest emerging issues and opportunities linked, for example, to the COVID-19 pandemic and its impact on social protection, climate change, and digital transformation. The fourth roundtable will consider the current situation, the remaining challenges and the opportunities with regard to the collection of disability data and other mechanisms to strengthen the tracking of progress on disability inclusive development. Now, I'd like to share with you a snapshot of disability inclusive development in Asia and the Pacific based on the findings of the surveys and secondary desk research. A larger proportion of persons with disabilities are not employed or outside the labor force across the region. Among the 21 countries and territories with data, the average employment to population ratio was 24% for persons with disabilities, while it was 62% for persons without disabilities. In many countries, social protection schemes are often inadequate, inaccessible, or unavailable for persons with disabilities. In 21 out of the 40 countries and territories with data, less than 50% of persons with severe disabilities collect disability social protection benefits. Children with disabilities are less likely to participate in early childhood education than their peers without disabilities. For the 7 countries with data, the median was 14% of children with with functional difficulties attending early childhood education, compared to 37% of children without disabilities. Women and girls with disabilities often face multiple and intersecting forms of discrimination. Among the 6 countries with data, the percentage of married women with functional difficulties who need family planning and have their needs satisfied with modern contraceptive methods ranged from 45% to 82%. Moreover, persons with disabilities are generally underrepresented in decision-making bodies. They account for only 0.8% of the total parliamentarians in the 10 countries and territories with data. Universal accessibility is yet to be achieved in the region. In 3 out of the 6 reporting governments, less than 10% of the government buildings were considered accessible. In addition, only 4 out of the 11 governments reported the availability of some accessibility features, such as adjustable contrast schemes and graphic elements with alternative text on their national government websites. Many governments experience difficulties in producing quality disability statistics to inform policymaking and programming. Only 9 out of 20 countries with data could report on more than 1/3 of the in-China strategy indicators based on their most recent census or surveys. 45 of the 51 Escap members and associate members with treaty-making capacity in Asia and the Pacific had ratified or acceded to the CRPD. At least 41 governments in the region have undertaken reviews of their legislation to improve alignment with the convention. In response to the Escap survey, governments highlighted their achievements, challenges, and priorities for disability inclusive development. The most often reported achievements included the development of disability laws, policies, and strategies, enhancement of physical accessibility, increased access to health and rehabilitation services for persons with disabilities, and promotion of quality education. Regarding the challenges, negative social norms and perceptions about disability, limited institutional capacity, and inaccessible environments were the critical issues most often noted by governments. In the coming decade, governments identified work and employment, disability statistics, accessibility, health and rehabilitation, and social protection as their top priority areas. The review of the progress on the implementation of the In-Chang strategy reveals that although advances have been made in disability inclusive development, persons with disabilities continue to face challenges in almost all sectors of society across the Asia-Pacific region. We must further strengthen meaningful partnerships with organizations of persons with disabilities in all areas of disability work, and promote a gender-responsive life cycle approach towards disability inclusion. The committee is invited to provide the Secretariat with examples and good practices of effective measures for disability inclusive development, take note of the issues that will be discussed as part of the high-level intergovernmental meeting and the preparatory work undertaken so far, and provide further guidance to the Secretariat on the preparations for the high-level intergovernmental meeting. This is the end of my presentation. We look forward to hearing from you regarding your country's good practices and innovative approaches to implementing the In-Chang strategy, Beijing Action Plan, and advancing disability inclusive development. Thank you, Madam Chair.
Thank you so much, Ms. Chai. I am sure that each and every country is working towards inclusive society, towards the same rights, the same human rights for disabled people. I am sure we will share a lot of good practices, a lot of good knowledge to each other, so we can learn from each other to create a better world for everyone. So, the introductory presentation of the session has provided us insightful overview of the work towards disability inclusive development in the Asia and the Pacific. And now I will turn the floor open for comments. First to speak, I have two speakers on CUDA online, Timor-Leste, which will be followed by Maldives. Distinguished representative from Timor-Leste.
Members, distinguished delegates, ladies and gentlemen. I would like to take this opportunity to emphasize that the Article 21 of our Constitution, Democratic Republic of Timor-Leste, states that all people with disability enjoy the same rights as well as other citizens, and that state shall promote the protection of persons with disability following the law. So the census 2015 of our housing and population shows out of 1.2 million, we have 3.2% of the population having shows that 4 types of disabilities: physical, vision, hearing, and intellectual. However, in August this year, we have launched the new national census, and probably this number will likely to increase. I'll take people with organizations of people with disabilities have been very vocal and active in working with the government to ensure that disability issues are included in our planning and budgeting across the line ministries. The adoption of the 2021 to 2030 National Action Plan for People with Disability manifests Timor-Leste's strong commitment to building a more disability-inclusive society. We have around 11 government agencies and civil societies are involved in the technical working group to better address the issues of persons with disability. As of July 2022, this year, Timor-Leste has ratified the UN Convention on the Rights of Persons with Disability and its optional protocols, making Timor-Leste has ratified all the 8 core human rights treaties. The ratification marks the strong commitment of the government adopted the policy of no one left behind in the implementation of the 2030 SDG agenda. Upon the ratification, there is more work to be done, of course, to ensure that disability inclusive development is key areas such as employment, accessibility, social protection, early childhood intervention, education, gender, and women empowerment. Around 10,000 people with disability are benefiting from our subsidy from the government every year, and also children with disability, around 8,000 are benefiting from our cash transfer program called Bolsa Damai. Equally, Timor-Leste will do our utmost effort to adopt the Jakarta Declaration on the Asian and Pacific on the decade of persons with disability, 2023-2032, to ensure its disability inclusive policy development. Timor-Leste will also set up a national commission for the defense of the rights of persons with disability to speed up and monitor the implementation of the CRPD in the country. Likewise, the harmonization of the national law is in alignment with the convention is an urgent need. As such, Timor-Leste is ready to engage more with its partner in the regions, particularly the Escap, to implement the Incheon strategy to make the right for persons with disability. Thank you very much for the opportunity.
Thank you so much, Timor-Leste. Next to speak is distinguished representative from Maldives.
Thank you, Madam Chair. Excellencies, honorable speakers, distinguished guests, representatives from government and civil societies. It is a great honor to represent the Maldives and be part of this session. I am inspired by the spirit of collaboration among governments and civil societies represented in this meeting. On behalf of the Maldives, I am grateful for the opportunity to speak to you with you all. The government of Maldives is committed to ensuring the rights and well-being of persons with disabilities. The regulations and standards made under the Disability Act 2010 has helped implement many current services and programs. Awareness programs are conducted across Maldives, specifically on early identification and intervention, CRPD, Disability Act, and the regulations under the Act. Community-based rehabilitation program launched in 2021 by the ministry has helped us to decentralize and increase accessibility to rehabilitations and other targeted services across the country. Efforts are being made to increase employment opportunities and reduce discrimination faced by PWDs within the job market. Since 2019, we have started shifting previous approaches towards aligning profiles of PWDs to their job demand while working for employment opportunities. Hence, policy changes have been brought to the civil service regulations to accommodate and promote employment of PWDs within the government sector. The geography of the Maldives makes it challenging to ensure accessibility in many aspects such as transportation, access to services and information. Recent policy initiatives have been made by the ministry to minimize the current issues in accessibility within the public transport system. In order to increase access to information, media outlets are captioning their content, using sign language interpreters, and share disability inclusive information on different platforms. Social protection programs to offer financial aid and services to persons with disabilities began in 2010 with the implementation of the Disability Act. At first, started by providing monthly financial assistance, and currently the program has expanded to provide financial assistance to assistive devices, psychological profiling, and assistance to those living under poverty line. This program was enhanced in 2019 by providing financial assistance to therapeutic services. National Social Protection Agency is now working to launch the National Disability Registry System with revision to the current social protection programs by the end of 2022. Ministry of Education is mandated to establish quality education to PWDs. Inclusive Education Policy 2021 is formulated under Article 8 Education Act to ensure the rights of all students to education. Additionally, the Ministry of Higher Education recently started developing avenues to increase access to higher educational opportunities and skill-based training programs for PWDs. Though progress have been made in the disability sectors, there are key areas that needs to be addressed to ensure the rights and well-being of persons with disabilities, and every effort is being made to promote an inclusive, accessible, and sustainable society for all Maldivians. Thank you.
Thank you so much. Now to speak, next distinguished delegate from Iran, to be followed by Malaysia.
Well, good afternoon to all. I thank you again, the Secretariat, for the hard work to give me this another chance to present my delegation here. Would I please, may I ask the Secretariat to keep on hold, in order to deliver the statement. Thank you.
Okay, good. Next to speak, representative of Malaysia, to be followed by a distinguished representative from Korea.
Thank you, Madam Chair, Excellencies, ladies and gentlemen. Malaysia is committed to building an inclusive society for persons with disabilities that allow them to live fulfilling and independent lives, and this was translated into the policy for persons with disabilities and its plan of action, which was adopted in 2007. Following this, the Person with Disabilities Act was enacted in 2008 and provides for the registration, protection, rehabilitation, development, and well-being of PWDs, as well as the establishment of the National Council for Persons with Disabilities. This act is now being reviewed by a special project team which consists of academicians, medical and legal professionals, as well as civil society organizations representing various disability groups and government organizations. In Malaysia, registration of PWDs is not made compulsory under the PWDs Act, but as of July 2020, a total of around 600,000 PWDs have registered. However, this figure is not reflective of the actual PWD population in Malaysia. The government now has taken the initiative to collect data on PWD through the 2022 National Population Census to capture more accurate statistics on PWD population to be used by the government, policymakers, researchers, as well as individuals for the planning, formulation, and implementation of government policies. Malaysia provides various allocations to empower PWDs in many areas, which include education, training, employment, early intervention for children with disabilities, and infrastructure upgrades. In 2000 2022 budget, the government has allocated $20.5 million to enhance the creation of a barrier-free environment for PWDs. To better integrate PWDs into the community, the existing community-based rehabilitation or CBR program has been strengthened to provide early intervention, rehabilitation, and training for PWDs within their own community. The centers collaborate with various agencies, NGOs, community, and family members. The CBR program helps to ensure the acceptance and social integration of PWDs, including children, as well as providing them the opportunity to develop their abilities and skills to their full potential. As May 2022, a total of 568 CBR centers have been established throughout the country, benefiting 18,566 PWDs. For children with disabilities, the government has been providing yearly funding to selected NGOs that runs early intervention childcare centers for PWDs. The centers focus on specific categories of Down syndrome, autism, visual, hearing, physical, and learning disabilities. Malaysia continues to encourage and enhance smart partnership between government agencies and civil society organizations to provide skill training, rehabilitation, and care services for PWDs. In encouraging the employment of PWDs, several incentives are in place. A disabled worker allowance of $100 per month is provided by the government to encourage PWDs to work. The government implemented the policy of 1% employment opportunity in the public service for PWDs as a key performance indicator for all ministries. In the private sector, recruitment incentive under the Social Security Organization has been introduced, whereby employers will be given wage subsidies to hire PWDs. Malaysia will continue to increase efforts in creating awareness on the rights of PWDs to the general public to lower barriers, evaluate existing legislation through open communication, and allow for independent management by NGOs, as well as more creative initiatives by all responsible parties in making the rights real for PWDs. Thank you.
Thank you very much, distinguished delegate from Malaysia. Now to speak online, distinguished delegates from Korea, to be followed by China.
Thank you, Madam Chair. Recognizing the issue of disability of poverty, the UN and the global community have specified disability inclusive development on a policy level in all development programs under Article 32 of the UN CRPD and included a disability in 5 out of the 17 UN SDG, which aim to leave no one behind. With guidelines for executing disability inclusive in international development cooperation in 2017 and COICA's executive plan on human rights-based development cooperation in 2020. The Korean government is also continuously making policy efforts in laying the groundwork for including disability, which has been excluded so far. In development cooperation as the issue that encompasses all areas. Disability inclusive development refers to including the perspective on disability in the whole process of development, from planning to execution, monitoring and assessment, and ensuring meaningful and effective participation of persons with disabilities in development processes and policies. In other words, in disability inclusive development, persons with disabilities participate as the actor of the development activities and also as the beneficiary of the development. For the success of the China strategy, which is presented the disability inclusive development goals on the regional level for the first time, the Korean government has yielded many fruitful outcomes as the leading country of the Asian and Pacific Decade of Persons with Disabilities 2013 to 2022, cooperating with the Asia-Pacific region. In order to support the establishment of a practical system for carrying out disability policies, it assesses the effectiveness of the planning and execution of disability-related policies in the Asian Pacific region. It has also provided 17 Asian Pacific countries with the consultation on building disability statistics and support for establishing national action plans since 2013 in order to build comparable disability data, particularly by establishing Make the Right Real Fund and designating the Korea Disabled People's Development Institute as the operator of the Incheon strategy. The Korean government has continued technical cooperation for developing and operating disability-inclusive policies and programs in member countries. With Make the Right Real Fund, UN Escap has endeavored to achieve the 10 goals of the Incheon strategy, collaborating actively with the international organizations, governments, and civic groups in the areas of poverty, social participation, accessibility, gender equality, and education. There have been domestic achievements as well, such as abolishing the disability grading system and continuously increasing the level of disability pension payment while securing representativeness of persons with disabilities in political decision-making processes under the Incheon strategy. The government has also put steady efforts in improving the legal and institutional systems as shown in establishing the Act on Guarantee of Rights of Support for Persons with Developmental Disabilities, the Korean Sign Language Act, and the Legal Grounds for Living Environment Without Obstacles.
Thank you.
Particularly, the Korean government has been very active in taking policy measures to protect the lives of persons with disabilities and to ensure their safety and access to healthcare amid the COVID-19 pandemic. It enhanced the accessibility to information for persons with disabilities to make sure accurate information on the infectious disease can be delivered by providing major COVID-19 policy presentations and response manuals in the form of sign language, braille, and audio conversion too. Also, it has operated separate hospital beds for the infectious disease dedicated to persons with disabilities in order to provide them with a customized medical support and stable treatment. The government has improved the personal assistance service for persons with disabilities to make sure that necessary care services can be continuously provided for COVID-19 cases with
Thank you so
disabilities.
much. You
And
have to wrap up.
taking measures to prioritize vulnerable groups, including persons with disabilities, and vaccinating its people.
Thank you so much. Please
These,
end
yes,
notes.
these efforts by the Korean government made at home and abroad for complying with international conventions to ensure rights of persons with disabilities were favorably received by the UN CRPD Committee at the third National Review on Korea's CRPD implementation, which was
Okay,
held at
thank
the
you
end
so
of
much. Thank you. Thank you,
Yes.
Korea. Thank you.
Thank you.
Next to speak, representative of China, to be followed by Indonesia.
那我打
可以了吧？可以了吧？主席女士，过去几年，中国在执行仁川战略和北京宣言及其行动计划方面取得显著进展，推动加速残疾人事业发展。中国有8500万残疾人，贫困曾经是中国残疾人最大的困境。在过去的10年，710万农村贫困残疾人摆脱了绝对贫困。我们建立了困难残疾人生活补贴和重度残疾人护理补贴制度，2700多万残疾人受益。我们为残疾人提供社区和居家照料服务。我们重视无障碍建设，今天在各个城市， 无障碍设施随处可见。我们重视发展高质量融合发展，我们重视高质量融合教育，每年都有1万多名残疾学生被高等院校录取。我们建设国家级康复大学，培养更多专业康复人才。我们重视残疾妇女发展，为残疾妇女就业创建美丽工坊。我们保障残疾人参与社会政治生活的权利。中国现在有6000多位残疾人和残疾人权益代表，担任各级人大代表和政协委员。中国充分认同仁川战略和北京宣言及其行动计划与残疾人权利公约和联合国2030年可持续发展议程的内在协同作用，认识到它们作为支持包容性和可持续发展的独特工具的重要性。仁川战略和北京宣言及其行动计划提供了一个有效框架，促进残疾包容发展。中国重申，在未来10年将继续实施仁川战略和北京宣言及其行动计划。今年标志着第3个亚太残疾人10年的结束。在这一关键时刻，中国赞赏亚太经社会对第3个10年仁川战略和北京宣言及其行动计划的执行情况进行中期审查，评估取得的进展，并继续为残疾人制定创新政策和方案。这一审查至关重要。10月将举行亚太残疾人10年高级别政府间中期审查会议，中方愿为此次重要会议做出实质性贡献。中方期待与国际社会继续合作，实现亚太地区残疾人包容性发展的共同目标。谢谢主席女士。
Thank you so much, distinguished delegate from China. Now to speak, distinguished delegate from Indonesia, to be followed by Japan.
Thank you, Chair. The government of Indonesia is firmly committed to ensure the respect, protection, and fulfillment of the basic rights of approximately 22.97 million citizens with disabilities to the enactment of the Law Number 8 of 2016, based on the adoption of the UN Convention of the Rights for Persons with Disability, or CRPD. The law embodies the paradigm shift from a charity-based approach to a rights-based perspective. Furthermore, Indonesia Disability Inclusive Development Master Plan, as stipulated in Government Regulation Number 17 of 2019, covers 7 strategic targets, consisting of data collection and inclusive planning, providing an environment without barriers, protection of rights, including political rights and access to justice, empowerment and independence, realization of the inclusive economy for persons with disabilities, education and skill, and access to an equitable health service. This regulation states the policy to formulate the 25 years long-term master plan for persons with disability, or RIPD, the 5 years medium-term national action plan for persons with disability, or RANPD, and sub-national action plan for persons with disability, or RADPD, as well as short-term planning for annual program and activity in ministry or agency, provincial and district or city governments. BPS Statistic Indonesia has contributed in disability data collection by utilizing the Washington Group short set in the annual survey, including the National Social Economic Survey, or SUSENAS, and the National Labor Force Survey or SESCANAS. However, the surveys are designed to desegregate other indicators by disability stages. Fully aware of the existing, the emerging challenges for the promotion and protection of the rights of persons with disabilities, both nationally and regionally, Indonesia is pleased to host the UNESCO high-level intergovernmental meeting of the final review of the Asian and Pacific Decade of Persons with Disability 2013 2022 in Jakarta on 19 to 1st October 2022. This opportunity to host the intergovernmental meeting reaffirms Indonesia's commitment to accelerate and to redouble our collective efforts on the implementation of the CRPD, the ancient strategy to make the right real for persons with disability in Asia and the Pacific, the Beijing Declaration, including the action plan to accelerate the implementation of the ancient strategy in the region, through sharing experience and expertise. We would therefore greatly appreciate your kind attendance and active participation in the meeting and look forward to seeing you in Jakarta in October. Thank you.
Thank you so much, distinguished representative from Indonesia. I would like to express my sincere appreciation for hosting the next conference in Jakarta in October. We will all member countries will be very joyfully joining you. Thank you so much.
Okay, thank you.
Next to speak, distinguished representative of Japan on site, to be followed by distinguished representative from India online.
Thank you, Madam Chair, for giving me the opportunity to speak in this important agenda. Good afternoon, everyone. For more than 20 years, Japan has been working with the UN Escap to address issues related to persons with disabilities during the first and the second Asia-Pacific decade of persons with disabilities. Support for persons with disabilities is important for Japan. Since the adoption of the SDGs, Japan as a whole has been actively promoting the SDGs and is working on various measures to realize a society in which no one is left behind, including those with disabilities. We see it meaningful to continue extending our support for UN Escap in this period. Here, I would like to overview Japan's international cooperation for persons with disabilities. In relation to the implementation of the Incheon strategy, we are extending cooperation program in Rome, which consider for the use of people with disabilities by designing for barrier-free facilities in railways and airport construction, for example. In grant aid, we take into consideration the use of people with disabilities. Every year, we implement cooperation programs such as improvement of elementary school facilities, the construction of schools for children in special needs, and the provision of transport minibus. In fiscal year 2020, we implemented 37 grant projects through NGOs, totaling approximately $5 million. In the area of technical cooperation, JICA is providing a wide range of cooperation, including the acceptance of trainees and dispatch of experts and JICA overseas cooperation volunteers in order to support the social inclusion of persons with disabilities and the realization of their rights in developing countries. For UN Escap, we have been working on the development of e-learning tool for tsunami disaster prevention that are inclusive of persons with disabilities. In March 2021, we started a project to support the formulation and the implementation of policies related to inclusive disaster prevention for PWD that also take gender equality into consideration by utilizing this e-learning tool. Through the implementation of this project, we are supporting policymakers and community leaders engaged in disaster risk reduction in the central and local governments of the target country in Southeast Asia to adopt concrete measures for inclusion of people with disabilities and gender equality. Madam Chair, we will continue to share the knowledge and good practices from our experience in Japan through this committee of UN Escap and other international and regional fora. Japan, in close cooperation with UN Escap, remains committed to contributing properly to programs for people with disabilities in the Asia-Pacific region. Thank you for your attention.
Thank you so much, distinguished delegate from Japan. And as a chair, I would like to take the opportunity to express my appreciation to Japan for doing great work, especially in the area of disabled people at international level. I thank you so much. We are having also a lot of programs and projects in Mongolia through JICA. Please keep the work in the future.
Thank you, Madam Chair.
Thank you. Next to speak, distinguished delegate from India. India, yes, to be followed by Pakistan.
Please unmute yourself.
India, I think you have to unmute yourself.
Maybe we go first to Pakistan and then we can go to India.
We have accepted, but it says done speaking. Okay, maybe we should go to Pakistan first on site and then go back to India.
Thank you very much, Madam Chairperson, for inviting me to speak on this important agenda about persons with disability in this region. The government of Pakistan is committed to ensure protection of rights of persons with disability in line with its national and international obligations. These obligations include Constitution of Pakistan, the important international document UN Convention on the Rights of the Person with Disabilities, and ICT Rights of Person with Disabilities Act 2020 that has been promulgated in consequences of the ratification of UNCRPD by Pakistan. The government is accordingly adopting all possible measures for rehabilitation and inclusion of persons with disabilities within societies in Pakistan. The step taken so far by the government for the PWD's education, training, and rehabilitation, as well as inclusion of society of PWDs through implementation of various laws and programmatic measures in the country. These major actions includes the ICT Rights of Persons with Disabilities Act 2020 has been enacted. This act provides legal institutional framework for an inclusive society where PWDs have full participation in all forms of social life, particularly in health, education, and employment. The major aim of this law is to ensure rehabilitation of PWDs through protection and promotion of their rights. Council for Rehabilitation of Disabled Persons has been constituted in this regard to implement the law that has been promulgated in 2020. Similarly, the provincial governments has also promulgated their laws for protection of rights of persons with disability and to ensure the inclusion of these persons in society. Sehat Sahulat program under Benazir Income Support Program launched to ensure PWDs access to social health protection initiatives. PWDs and their families are provided with free of cost health insurance to secure indoor health care services. More than 100 normal schools have been made inclusive in Islamabad, providing children with disabilities ease to access and mobility. National Committee for Implementation of UNCRPD have been constituted, having representation of provincial government under the chair of Federal Minister for Human Rights. The National Committee is mandated to recommend policy, legal, and administrative measures for protection of rights of persons with disabilities and their rehabilitation and empowerment. Madam Chair, insurance strategy is one of the international obligations which outline 10 Disabilities Inclusive Development Goals, 27 targets and 62 indicators to be met by the end of this year. The Ministry of Human Rights has provided response to survey for midpoint review of Incheon strategy. However, data on disability was found as a major challenge while preparing responses on various indicators of the Incheon strategy identified in the survey. Response for the final review of Incheon strategy have been prepared and submitted with and shared with UN Escap this year. To combat the challenges of the data generation, Pakistan Bureau of Statistics and Benazir Income Support Program have committed to collect data on PWDs, including Washington Group, short set of questions through their ongoing and upcoming surveys. The Government of Pakistan has welcomed the UNESCAP technical support aimed to collect reliable and comprehensive disability data needed for tracking progress in achieving the Incheon goal and targets under the UNESCAP project on data collection for the Incheon strategy to make the right real for persons with disabilities. Madam, I thank you very much for your attention.
Thank you so much. Next to speak, distinguished delegate from India, to be followed by Bangladesh. India is having connection issues. We should follow with Bangladesh.
India will.
Honorable Chair, distinguished participants, very good afternoon. The government of Bangladesh is committed to address the disability rights issues with a whole of society approach, including through family, development partners, parliamentarians, media, National Human Rights Commission, and others. Bangladesh is governed by the National Constitution of 1972, which is based on the principles of equality, human dignity, and social justice for all citizens. The general provision, principles, and obligations of the CRPD are similar to the general and fundamental principles and directives of the Constitution of Bangladesh. Distinguished participants, the government has created enabling environment through setting up legal framework, through enacting acts, formulating a number of rules, regulations, policies, and work plans in order to take subsequent initiatives and measures in accordance with the provisions of the CRPD and Incheon strategy. The names of some sort of legal instruments itself would provide a clear message as to how intensely Bangladesh has been focusing to ensure that the rights instinct in the CRPD. Some of the legal instruments include Rights and Protection for the Persons with Disabilities Act 2013, Neurodevelopmental Disability Protection Trust Act 2030, Mental Health Act 2018, Bangladesh Rehabilitation Council Act 2018. Besides the legal instruments, the government also established two statutory bodies named Neurodevelopmental Disability Protection Trust and Bangladesh Rehabilitation Council. Honorable Chair, now I would like to share some of our steps to make the right real. We are organizing the poor along with PWDs and bring them into the mainstream of society through field level offices and providing microcredit program. We are established different kind of training and rehabilitation centers, organizing job fair for employment, providing grants and loan to the DPOs, and apps Emporia has been developed. Distinguished participants, the Rights and Protection of Persons with Disabilities Act of 2013 ensures the engagement of DPOs and relevant NGOs in all activities to protect the best interest of persons with disabilities through different committees and ensures that Public establishments must be accessible to people with disabilities. The government has taken initiatives to make 25,000 government websites accessible. Steps have been taken by the government to ensure accessibility by following universal accessibility guideline in Bangladesh Building National Code along with need for assistive devices. Honorable Chair, all PWDs are receiving allowances gradually. Besides, financial assistance has been providing to them, provide one-time medical allowance, and our government has launched a health insurance policy titled Bangabandhu Suraksha Bima for persons with neurodevelopmental disabilities. Honorable Chair, 103 neurodevelopmental disability corner and IPNA is working for early intervention and for therapeutic services. Different types of schools have been established for education. Child helpline is working. Honorable Chair, in 2015, Bangladesh government adopted national disaster management policy where participation of PWDs have been ensured.
Thank you so
Different
much.
kinds
Please
of
wrap up.
assistance have been provided to the PWDs which are continuing to flood affected area also. Special steps have been taken to ensure the vaccination. The
Thank you so
government of
much. Thank
Bangladesh
you.
is conducting a
Thank you.
disability detection survey program to calculate accurate statistics for people with disabilities through a software. We are implementing
I don't think she's
two long-term action
hearing
plan.
us.
Thank you very much. Thank you.
Thank you so much. Okay, now we have the third attempt of a representation of India. Okay, please, distinguished delegate from India, to be followed by Iran.
Am I audible?
Yes, please.
Madam Chair, distinguished delegates, ladies and gentlemen, a very good afternoon to all of you. Madam Chair, thank you for giving us this opportunity to share with this August gathering India's position on implementation of insurance strategy to make the right real. The Government of India enacted the Rights of Persons with Disabilities Act 2016, which came into force in April 2017. The Act broadened the horizon of the rights and entitlements of persons with disabilities, which inter alia includes equality, non-discrimination, protection against violence and abuse, exploitation, community life, reproductive rights, legal capacity, access to justice, and so on. It also provides for promoting health, education, rehabilitation, sports, and recreation for persons with disabilities. The Act mandates not less than 4% reservation in government job for persons with benchmark disability of 40% or more. The government also notified 3,566 categories of posts identified suitable for various categories of persons with benchmark disabilities. Since 2015, more than 14,000 backlog vacancies meant for persons with disabilities have been filled up in various central government establishments through special recruitment drives. Recently, the Government of India has also allowed reservation in promotion for persons with disabilities in central government establishments. The Government of India constituted the Central Advisory Board on Disability and mandated, as mandated under the Rights of Persons with Disabilities Act 2016, which acts as the highest policy recommending body. Similarly, at the state level, the state advisory boards have been constituted. These bodies have representation of 10 members belonging to persons with disabilities or their associations. The Chief Commissioner for Persons with Disabilities and the State Commissioner for Persons with Disabilities are responsible to monitor the implementation of the Act and also look into the grievances regarding deprivation of rights of persons with disabilities. Indian Sign Language Research and Training Center has been set up to promote standardized Indian Sign Language across the country for the benefit of persons with hearing impairment. The institute has developed ISL version of school curriculum up to class 5 and also developed sign language dictionary of 10,000 words. National Disaster Management Authority has issued guidelines for disability inclusive disaster risk reduction in September 2019. The government also set up the National Institute for Mental Health Rehabilitation, which will work towards rehabilitation and integration of persons with psychosocial disabilities. During the period from 2014 to 2021, the government has distributed aids and assistive devices amounting to US $173 million. Accessible India campaign was launched in December 2015 for creating barrier-free environment in three verticals, namely built-up environment, transportation system, and ICT ecosystem. To improve the data, the government is implementing the unique disability identification project for creating a database of persons with disabilities. Identifying each eligible
Please wrap
person
up.
with disability and inclusion under UDID is a real challenge. So far, more than 8.2 million unique disability ID cards have been generated through this portal. Given the size of the population of persons with disabilities in the country and the aspirations of PWDs or the persons with disabilities vis-a-vis the obligations under the RPWD Act 2016, managing the right kind of resources in a time-bound manner remains a challenge. As on date, there are about 0.18 million rehabilitation personnel registered with Rehabilitation Council of India. The
Thank you
government
so
is
much.
also
Please wrap up.
continuously working on meeting the gaps in rehabilitation on rehabilitation professionals and personnel in the country through setting up of new institutions as well as reviewing the program run by the Rehabilitation Council of India. The national development agenda of the government are in line with the
Thank you so much. You
SDG
have to
goals.
wrap up.
I'll just conclude. Various government programs aim at empowerment of the last man in the queue, including persons with disabilities. Niti Aayog, through its output and outcome framework, monitors the progress of implementation of the SDGs in India. To conclude, the
Thank you so
data
much.
on disability-specific indicators in terms of inch-on strategy is not separately maintained. However, once the UDID project is completed, it will be linked to this service delivery mechanism, which
Okay.
will help us
Thank you so
track
much.
disability segregated data in education, health, and other sectors. Thank you so much for your kind patience. Thank you.
Thank you so much. Now, a distinguished representative of Iran will make his short intervention.
Thank you again, Madam Chairman. Madam Chairperson, at the outset, I would like again to extend my sincere appreciation and thank to the Secretariat for their hard work. And due to some internet connection to Kodo, which is not acceptable in my country, we have some limitations regarding active participation of delegation to the sessions. We can say due to some limitation imposed by unlawful unilateral coercive measures, UCM. So these problems still remains, and I strongly recommend that provide the member states, an easy online platform to provide an equal access for all member states. Mr. Chairperson, while respecting the compromise and the consensus reached during the rounds of negotiations of Jakarta Declaration on the Asian and the Pacific of Persons with Disabilities, my delegation still has got some serious reservation about some paragraphs. We don't want to break the silence procedure, of course. We respect the hard working of the all delegations during rounds of negotiation, but we dissociated the Iranian delegate from those paragraphs that pointed out gender in the text. For example, paragraph 4 and paragraph 14. So we strongly dissociated the delegation from this wording in the paragraph. If we go more to details, there are some other terms which we have got a serious reservation about them. Health service is another example. So health services, which is put on the text, is a little bit problematic for the delegation, for Iran delegation. We want to go through the details, and we still keep the consensus, and we don't want to break the consensus. We respect the hard workings of all delegations. Finally, we asked the Secretariat to provide the online platform in order to deliver, we can say, to deliver our requests and our deliberation to the negotiations. Still, this problem remains, and hopefully, to have an access to another platform, online platform. We just want to avoid, some future problems in the platform, in order to have an active participation. Okay. I want the Secretariat to register, the reservations, the Iran reservations regarding the Jakarta declarations. And thank you again, Madam Chairperson, for the hard work.
Okay, thank you so much, distinguished representative of Iran. Please provide us your statement. As also, I'd like to invite Mr. Tata to respond to the concerns of Iran.
Thank you, Madam Chair. As you said, we'd be very happy to receive a written copy of the delegate's statement. We take note of your technical issues in connecting, which we are made aware, made our CMU aware, and we hope that we'll be able to address it to the extent possible. And we note your very clear desire not to break the consensus on the Jakarta Declaration, which is highly appreciated by everyone, but we would be very happy to take note of your reservations and reflect them as appropriate in the report or the proceedings that will be issued after the meeting, and also in the lead up. But thank you very much, Madam Chair.
Thank you so much. My colleagues, please do get the notes from Iran. Next, I would like to go to international organizations to take the floor. First to speak, on-site participant, APSD, which will be followed by online participant, Development Welfare and Research Foundation.
Thank you so much, Madam Chair. Asia Pacific Development Center on Disability, in short APCD, is the regional disability inclusive development agency in the Asia Pacific region located in Bangkok. We have been established by collaboration between government of Japan and Thailand and start to implement our mission since 2002. We highly appreciate UN Escap for implementing as a focal entity to proactively promote disability inclusive development in our region. UN Escap has endorsed APCD as a regional cooperative base for Bivako Millennium Framework for Inclusive Society 2003 to 2012 and its Incheon Strategy 2013 to 2022. UN Escap and APCD have agreement on collaboration to promote various international instruments regards disability inclusive development, include UNCRPD, Incheon Strategy, ASEAN Enabling Master Plan 2025, SDGs, and Sendai Framework. So far, the four main areas implemented as partnership collaboration between ESCAP and APCD are disability inclusive development, disability inclusive business, disability inclusive disaster risk reduction, and lastly, disability inclusive COVID-19 response. We are looking forward to participate on high-level intergovernmental meeting on the final review of the ASEAN and Pacific Decade of Persons with Disabilities 2013 to 2022 in Jakarta. We are also looking forward to have the next decade, which proactively promote on existing international instruments, enhance and link among regional, sub-regional, national, and community levels, as well as empower persons with disabilities, particularly in terms of employment and self-reliance in their communities. Thank you so much.
Thank you very much, distinguished delegate from APSD. Now to speak through online platform, Development Welfare and Research Foundation, to be followed by Pacific Disability Forum.
Thank you, Chair. I find the Make the Right Real a very sensitive, a meaningful strategy, and an action-oriented approach. However, my positivity about disability inclusive development goals is to some extent hampered as productive capacities of persons with disabilities have yet to receive the due recognition in many countries of the region. Availability of data on contributions of people with disabilities, especially of adults, needs to be put in public spaces for greater visibility and for giving credit to their strengths as well as role in development. Also, the lack of sensitivity to the concerns of disabled persons aging is another area which worries me as a person working on aging issues for long and also as an advocate for the importance of rights of all people, especially by understanding vulnerabilities of different groups of people. The heterogeneity among persons with disabilities often goes unnoticed by the society at large. There is an urgent requirement to make note of different needs of persons with disabilities. Deficiency of this much needed approach to address concerns of people with different types of disabilities was visible during the COVID pandemic. It is a lesson for us to take much needed action and do much more than what has been put in place for ensuring disability inclusive disaster risk reduction and management programs. To my mind, charting of the new course of action for the Asian and Pacific Decade of Persons with Disabilities 2013 to 2022, while has been put in place in many ways, but requires potentially a strong push towards implementation of it at grassroots levels in meeting multiple needs of people with disabilities by taking into account sex and age differentials, along with consideration of their social and economic status. Improving the images of people with disabilities in society must get priority with different stakeholders. This can be facilitated and achieved by collecting robust data on persons with disabilities by geographically covering all and taking note of differential factors. Thank you.
Thank you so much. Now I have two speakers left on my list. Pacific Disability Forum and South Asian Disability Forum. Both are participating online.
We on?
Yes, please.
Madam Chair, Excellencies, ladies and gentlemen, A very good evening from Fiji and the Pacific. Firstly, I wish to congratulate Escap for the three decade initiatives. During the regional initiatives, Escap Disability Unit and we, Person with Disabilities, and our representative organizations, together contributed to the speedy drafting and development of the Convention on the Rights of Persons with Disabilities and ensuring that SDGs are reasonably disability inclusive. Pacific Disability Forum, formally inaugurated in 2004, collaborated with the Pacific Islands Forum Secretariat to develop two regional sub-regional disability framework. The Pacific Regional Strategy on Disability 2010-2015 and the Pacific Framework for the Rights of Persons with Disabilities 2016-2025, both adopted by the forum leaders. Incorporating the content of the Biwako Millennium Framework, the guiding document for the second Asia Pacific decade, and the ancient strategy, so the first decade, and the ancient strategy, which is guiding the current decade. It's about to conclude in a few months. I, representing Voice of Persons with Disabilities in the Pacific, agree to the challenges presented by the Secretariat and acknowledge that we still need to do a lot more in the coming years. Ladies and gentlemen, disability inclusion is widely talked about and well documented. But to implement it, meaningful participation of persons with disabilities in our representative organization is a must, including the decision making at the judicial, legislative, and administrative branches of government that are ensured. We no longer need tokenistic participation, and we no longer need ableism approach to disability, which is still permeated through various development initiatives. We also like to see persons with disabilities participating actively and meaningfully in the preparation and finalization of the voluntary national reviews of our governments in our region. The Pacific Disability Forum looks forward to a dynamic discussion on these matters in the forthcoming high-level intergovernmental meeting on the finalization of the current decade to be held in Jakarta in October, and explore productive ways to make the right really real for 700 million persons with disabilities in our Asia and the Pacific region. Thank you and good evening from Fiji.
Thank you so much. Greetings to Fiji. Last but not least, to speak, representative from South Asian Disability Forum.
Hello. Good afternoon, everyone. Thank you very much, Mr. Chair. I hope all of you are aware that Pakistan has been hit by a devastating flood in last few weeks. I'm currently in the field in one of the flood-affected areas, so my voice would be dropping out at some point, but I will try to be very brief and complete my deliberation. The global agenda for sustainable development 2030 cannot be achieved without ensuring disability inclusion and equality.
Yeah, unfortunately, the connection.
For the implementation of insurance strategy to make life real for persons with disabilities in the Asia and the Pacific. South Asian Disability Forum has also been lobbying and advocating for the government in the region successfully and has been successfully raised the voices of persons with disabilities in the parliaments in South Asian countries. As mentioned by one of the delegates, distinguished delegate from Pakistan, Director General Human Rights, that a national committee has been formed under the leadership of Federal Ministry for Human Rights to implement the Convention on the Rights of Persons with Disabilities and the insurance strategy. And a special committee for the first time in the history of the country has been constituted for the person with disabilities by the Speaker National Assembly. Even after having all the political commitments and policy level efforts, persons with disabilities in the region continue to face barriers in many aspects of life, including employment, participation in the decision making, accessibility, and education. The most common barriers reported as are negative norms and the lack of understanding of the disability from the social and wide-based perspective. Ableism is still persistent in people's subconsciousness, dictating their behavior to sustain the negative perspective about disability, about person with disabilities. They are still being considered as the people with lesser capacities who need rehabilitation. They are still counted as passive recipients of charity and remain excluded from the development processes. Less than 1% of entire workforce in the country, particularly in corporate sector, are persons with disabilities. These homogeneous groups. The perspective of intersectionality is critically important for inclusive development and needs to be addressed in both disability-specific laws and mainstream laws. Ladies and gentlemen, on the final review of the Asia and Pacific Decade of Persons with Disabilities to be held in Jakarta in October 2022 for further and in-depth deliberations on the remaining challenges and set a course of the next 10 years for us. For that, meaningful participation of persons with disabilities is the key. People with disabilities in South Asia and beyond are looking forward to further partnership with Escap. I thank you, all of you. I thank you, Ms. Chair.
Thank you so much, distinguished delegates from South Asian Disability Forum participating from Pakistan. We do feel very sorry for Pakistani people, and thank you so much for participation, even though flood and being in a car. Thank you so much. I am done with my list of speakers on today's list. I see none who are wishing to speak more. So thank you for your statements, which have highlighted the efforts of your governments or organizations have made towards disability inclusive development. Your statements confirm that the region's commitment to continue working towards the inclusion of all persons with disabilities until we fulfill the promise to make the right real. The final review of the disability decade is a key milestone in this endeavor. On this basis, I would like kindly encourage active participation of all members and associate members in the high-level intergovernmental meeting on the final review of the Asian and Pacific Decade of Persons with Disabilities 2013-2022, to be held in Jakarta from 19th to 21st October 2022. Excellencies, distinguished delegates, we will now move forward to the last agenda item, which is namely other matters. Are there any other matters that delegations would like to rise up? I see none, so I would like to go to my next due. Excellencies, distinguished delegates, it is my pleasure to report on behalf of the Bureau on the status of credentials of representatives of members of the 7th session of the Committee on Social Development in accordance with Rule 12 of the Rules of Procedure of the Commission. The Bureau of the 7th session of the Committee on Social Development examined the credentials of representatives of 27 member states submitted in accordance with the Rule 11 of the Rules of Procedure of the Commission and found them to be in order. The Bureau decided to defer any actions on the credentials pertaining to the representatives of Myanmar at the 7th session of the Committee on Social Development, pending a decision by the General Assembly on the representation of Myanmar in line with the General Assembly Resolution 396 the 5th of 14th December 1950, acknowledging the report of the Credentials Committee of the General Assembly at its 76th session. May I take it that it is the wish of the committee to take note of the report of the Bureau? Any objections? I don't see any. So it is decided. With this, I think, Mr. Tata, we are at the end of our today's session. This is now concludes our deliberations today. The Secretariat will prepare a report of this meeting for our review by noon, so by 12 o'clock tomorrow. Thursday, the 8th September. We will all be back at 2 p.m. here in this room. The report will be made available online as also emailed to the list of the participants. As explained, the report will only contain the main decisions and recommendations of the meeting as well as its organizational aspects. A summary of the proceedings will be circulated by the Secretariat for factual corrections within a week of the conclusion of the meeting and then annexed to the report. If there are any major changes to suggest, of course, we would request you to provide the written text to the Secretariat before 2 o'clock tomorrow, so that they may enter it on screen for consideration by all delegations. We will then resume the committee tomorrow at 2 p.m. in conference room 1, as well as on CUDA and YouTube live streaming to consider agenda item 7, which is the adoption of the report of the committee at its 7th session. I very much look forward to your participation tomorrow as actively as today also. I would like to invite Secretary to provide some housekeeping notes if you have any housekeeping notes.
Thank you, Madam Chair. Just to reiterate that the draft report of the committee will be available by 12 noon tomorrow. Thank you.
Okay. Thank you so much. So I declare this meeting adjourned. Have a good evening.